All right, thanks for coming, Jared. So tell me a little bit about your practice, what it's called, that sort of stuff.
Sure. So my practice is called Hutch Health Services, and it's a concierge physical therapy practice. So basically, I work with individuals on a one-on-one independent basis, and the concierge basically just means it's for the patient, all about the patient. We don't deal with insurance companies and their limitations and their rules and restrictions that come with going through the medical system and going through the insurance-based system when we're doing our healthcare. It's all about catering to the person in front of you.
Awesome. So when people have to go through insurance, they get a certain number of sessions they're allowed to do, yada, 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 and so they get to bypass all of that, or?
Correct. So when someone uses their insurance for physical therapy, and if you have insurance, you certainly can still see me.
Yeah. Because you can always bill it to your insurance afterwards, and then...
Correct.
Yeah.
Everyone's insurance is different, and it gets really complicated, but most people will have some level of what's called out-of-network benefits. And so that's the insurance term for someone in my boat is I'm an out-of-network provider for all insurances. You know, most providers might take a certain insurance and not this insurance. They'll be in-network here or out-of-network here. I'm out-of-network for all insurance.
And what I've experienced is my insurance is terrible, and so I'm always stuck with my limited number of people I can go see, and I don't know anybody on the list, so I'm always going out of network.
Exactly. That's the same thing for me. My primary care physician is out of network for my insurance that I have right now. I very rarely go to the doctor. Luckily, I'm healthy and fortunate in that way that I don't have to use it a lot. And if I do, I'm paying 100% out of pocket until I have a really high deductible. I have like $8,000.
I know, that's what mine is. That's why everyone in network doesn't work for me, just because I've got the cheapest one, because I got the super high deductible.
Right. So it's just a little bit different than what you might consider the traditional norm in terms of the first thing a lot of insurance-based companies or in-network healthcare companies are going to ask you are, well, what's your insurance? Let's check your benefits and see what you're allowed to have and what you're allowed to do, and then we base some of your treatment strategies off of what your benefits dictate.
Yeah, what the insurance is willing to cover.
Right. And in physical therapy, some are really great and give you 100 visits for the year. Some give you 12 visits for the year. And some of them are covered, again, a large amount of that is covered at nothing out of pocket, or you're paying $30 per visit until you've met your deductible. Some of them, the high deductible plans, it's 100% out of pocket for you, and you still have a limitation on how many visits you can have. And so for me, making that decision was to allow me to not worry about what the insurance company is telling us and be able to just figure out what does this person need? What's the best course of action for this person to get them the result that they want, and not worry about what the insurance company wants for that person, because those are not necessarily the same thing.
Yeah, awesome. Yeah, sorry for the tangent. I just know that's something that I've experienced a lot through the years with just different practitioners, and I know it's something that's confusing for people. And I know I like the idea of just being like, cost this much per session, here you go, I trust you, you can tell me, and I trust that the number of sessions you're going to tell me is correct, and not, oh, I can bill this many sessions to the insurance company and yada, yada, yada. I also like that the money's going to you, and it's not getting split with the insurance company in whatever proportions that they do.
Exactly. You'll find that exactly like you say, my pricing is consistent and and very transparent and straightforward. Here it is what it is. I'm a sole proprietor, so I can work with people a little bit in terms of if someone needs to develop a payment plan that works for them, instead of paying on a session by session basis, if they want to pay on a month to month basis or something like that, we can be creative and mess with that stuff. But it's very transparent. You're going to know up front. There's no insurance company coming back and telling you, oh, well, I know they charged you this much, but we only approved this much, and so 25 more bucks comes out of your pocket to the insurance company, or Or they'll say, we really don't know what the cost is going to be for you until we work with the insurance company, and there's all these red tape and loopholes and complications that come with that.
Yeah, so it's just straightforward.
Straightforward, down to the point, and it allows us to work on some issues that an insurance company might not really dictate worthy of their payment, that might matter to you, such as being able to do your favorite physical activities.
And actually, that exact thing happened to me. I went in, get my hip worked on, checked on. I was having a little bit of a nagging pain in my shoulder, and the therapist was like, oh, I can't work on your shoulder unless you get this. And so then I had to go back there, and it's like, I'm sitting here on the table, and you can't work on my shoulder because I'm only approved for you to work on my hip right now. So it's a really weird situation.
Yes.
And I think everything's related and linked, so I don't think those are two separate issues. Those are probably the same issues, kind of.
Yeah.
So.
And that does get to some nuance in terms of there's insurance policies that require, you are starting a new episode of care for a different body part, a different issue. You might have to start this whole process over of you need to see a physician first, you need to fill out this paperwork first, we have to get approval first. In Texas, if you're doing different body parts and different issues, you still would need to see a physician for an issue.
So maybe that's what was going on.
That can be the case
more
for
than the insurance.
Right. So insurance has policies and procedures, and there can be a long list of them.
Yeah.
The state of Texas has laws in place that for a physical therapist to work with you on something that's a formal physical therapy issue, that's a true injury, a true episode of care that would be requiring physical therapy. You can work with someone for 10 days to 14 days, depending. So for me, it would be 10 business days that you can work with me before we then need to say, okay, this is something that needs to be seen by a physician, just to check off and refer you, basically sign off that you're appropriate for physical therapy.
Yeah. And that's another one of those things that drives me crazy. I can only imagine how much it drives you crazy. Because same issue, I had to go to my general practitioner. I saw their assistant did some very rudimentary checks on me, and then she started writing a prescription, and I asked what that was for, and she was like, pain meds. And I was like, I don't want pain meds. I was like, can you write me a prescription for physical therapy?
Right.
But I had to go in knowing that I had to ask for it.
Yeah.
So if I went in, because I can't just go straight to the physical therapist, I have to go to the general practitioner. So that's what I think is crazy about Texas requiring that you're not qualified to let me know if you're needed or not.
Definitely.
But so I went in, but if I didn't know to ask for physical therapy, I would have been leaving with pain meds. And in kind of a culture of a lot of Americans looking for that quick, easy magic pill fix, a lot of people think the answer is rest, get some pain meds to make resting feel better, not painful, and then I'll be good. And it's like, I'm sure you agree that that is absolutely the furthest from what you should be doing.
For sure. So that's a big push with the American Physical Therapy Association, is what they have the term PT first. So basically, if you have pain creep up, you have some sort of condition come up, it's different if you had an acute trauma, right? I had an injury, I was in a car accident, I had a major fall, the bar came crashing down on my head and banged me in the head.
Yeah.
Now, as an athletic trainer, my separate side business or other certification, and a lot of physical therapists are trained in how to evaluate those initial things and say, yeah, you have an emergency situation, go to the hospital, go to the doctor. So certainly, and that's why you have that 10-day buffer, is that physical therapists, they have recognized, we do know when someone needs an emergency situation or needs to see the physician rapidly, and so it's okay to see a physical therapist first. But on the flip side, we also recognize when you have something that will be addressed really well through physical therapy, and you don't need to go down the line of seeing going to the emergency room or going to urgent care, where often they will prescribe you pain medications, which, as we said, they kind of can help you with pain a little bit, but they don't help you with recovery. They don't help you with healing, really. And it can send you down the spiral of extra costs with the extra treatments that you might get. And basically, there's a overdiagnosis and overtreatment that can occur in people that otherwise, with a little bit of education and communication and support, could get better, on their own.
Yeah.
Our bodies are amazing. They heal and they recover on their own, and not every situation, but in a large majority of situations, if you set your body up in the right situation with the right rest and nutrition and stimulus, and it's going to take care of itself in a lot of ways. And that's really a big part of what I do as a physical therapist.
Yeah. I think that's awesome, because that kind of points to another one of my, I guess this is turning into my frustrations, but everyone's an expert in what they're an expert in. And when you go see someone who's an expert in something, they see your problem from their lens.
Yep.
So an emergency room, they're triage.
Right.
A general practitioner is a medical doctor. It's like they're medicine.
Right.
So it's like a surgeon's a surgeon. So it's like, and if every now and then, and a physical therapist is a physical therapist. So it's like every now and then you run into those people who do have the holistic view. Mm-hmm. But I actually find, in my experience, just with family members in hospitals, with my experience going and talking to people, is very few have that holistic view. And so it's not to say don't trust your doctor. It's just put what your doctor's saying in context and kind of ask yourself, are they saying this because they are thinking of everything? Or are they saying this because this is what they're comfortable with? Hip pain, here's pain meds. It's like, yeah, you're a medical doctor. That story makes sense. But is that like the best solution? Right. And so just having, I think, the confidence to ask those questions, because that doctor who ultimately prescribed me physical therapy easily could have been like, no, in your situation, it's like, this is the thing. It's like, oh, good. Well, now I double checked, so now I can trust you, as opposed to, because she was baffled when I asked.
Yeah.
But another thing you just said I really, really liked also is rest, nutrition, but then you said stimulus. And I think a big thing that I run into in the gym is anytime anyone's got a nagging injury, anytime anything's going on, people tend to rest only. Mm-hmm. And then not only that, usually if you stop working out and doing these things, you're looking for whatever's going to make you feel better, which is ice cream or donuts or whatever. So then they actually do terrible nutrition. It's like when you're sick, you're like, I just want a quick win. Yeah. You're just looking for some way to win, and it's like good tasting food is what people go to, but then that actually prolongs your recovery. And then, so just if you could talk a little bit more about the stimulus part of recovery, because I think that's a misconception that a lot of people miss.
Yeah, I have a whole lot of that I want to get into, definitely, and there's some definitions I want to get into, define some terms for you, and explain kind of a physical therapist's approach to that stimulus and that tissue adaptation.
Awesome.
But before I get into that, I had a couple of things I wanted to kind of define out for us, and then Perfect. We can get into it. So we talked about, we're all experts in different areas of healthcare. Mm-hmm. So in my family, both my parents are medical doctors, and my sister is a physician's assistant. Okay, and I'm a physical therapist. All right, so we're all a healthcare family, and we all have our own specializations. Right? My dad is a family practice physician. He's also a sports medicine fellow, so he's a family practitioner for athletes, is what he does, mm-hmm. basically. And so he looks at that total, more of a health medical background, but he's the person that's going to basically direct their care, right? They come in and he's the one that will say, okay, you need physical therapy. You need to see an orthopedic surgeon. Mm-hmm. This is not actually an orthopedic issue. This is a neurological issue. You need to go see a neurologist. Mm-hmm. That's kind of what those family practitioners are meant as, that gateway into the system.
Yeah, and I think that's where that Texas law comes in.
Right.
And I love the idea of it, mm-hmm. but it does require that person to be really good at what they do.
Yes.
And to understand when to send this and this and this and this. And it is hard when I'm so pro physical therapy that it's hard when y'all don't have the ability to tell people when you're appropriate or not, and it has to go through a filter.
Yeah.
And you just hope that filter is good. And there are great ones out there.
Right.
But there's also not so great ones.
Yeah. There's good and bad
of everybody.
everything.
Yeah, exactly. It's physical therapists. There's some really terrible physical therapists.
For sure. I won't name names, but for sure. But so that's his expertise. Mm-hmm. My mom is a pediatrician, so she's an expert she actually works a lot with newborns and with babies and children all the way through 18. But she sees newborns before they leave the hospital, basically before they leave and go home with their parents, and sees them, through the age span, basically. But she's an expert in that area of care, and she's also primary care, because there's pediatric oncologists that work with cancer. There's all kinds of subspecialties in all of this, so it's very complicated. But my sister is a physician's assistant. And she works in a hospital setting, and she specializes in trauma. So she's helping people that come in and have a broken bone that's fractured. She's the one assisting the surgeon in putting in the nail, or helping them with sewing up the sutures at the end, or helping them with she also helps with joint replacements and really kind of whatever they need at the hospital she's at right now. Mm-hmm. But she's a surgical PA. And so, again, a different type of specialty. Mm-hmm. And so on her side, she's a surgical specialist. I used to work at a surgery center for a long time. And so what I would always tell my clients is the surgeon, think of them as a anatomy structural expert. They can look at your bones, your structure, your pictures of your tendons, your bone, not just your bones, but your anatomy, compare it to what's considered normal, and see the differences there. And if it can be from aging processes or from an injury process or an illness process, where they could say, okay, how can we correct your anatomy or change modify your anatomy, because we'll get into whether it's actually correcting and improving or not, but modify your anatomy so it more closely resembles normal.
Modifying it surgically.
Right, surgically modifying your anatomy. Mm-hmm. And sometimes that's reshaping a bone, sometimes that's sewing bones connecting bones back together, sewing tendons back together, transferring a tendon from one location to another so it more optimally assists when you've lost a certain tendon or something like that. So that's what they really focus on, is that structure, right, that anatomy. Physical therapists are in the realm of neuromusculoskeletal experts, okay? And we kind of consider ourselves the movement experts. So now we know anatomy, we're very familiar with anatomy, but we pay attention to how does the nervous system, so the brain, the spinal cord, and the nerves, control the muscles, as we kind of have a saying in school, the mind is the master of the muscles. Mm-hmm. Okay, so how does your nervous system control your muscular system that then creates that movement of the skeletal system? Okay, and so that's where we consider ourselves the movement experts. Mm-hmm. Surgeon, they're looking at images, they're working with you when you're laying flat on a table. Usually you're out when they're actually doing most of the work with you. Mm-hmm. I spend my time watching a live, fresh body actually move and assess, okay, how are you moving? What is it about the movements that you're doing that are limited or giving you issues, and how can we manipulate movement and use movement as a way to create better movement, basically.
Do you have examples of issues that you might see on a MRI or an X-ray that really aren't something that you would consider issues, or maybe it's an issue, but an issue that doesn't need to be addressed surgically, even though you can see it?
I'm glad you brought that up, because that's exactly the next point. You're right on the same page with me. So a great example, there's tons of examples of imaging findings not having a high correlation to pain and injury findings. Mm-hmm. So a really great example is in the spine. Mm-hmm. Degenerative findings in the spine, specifically degenerative disc disease, is a great example. I don't have the study with me here, but there's a study where they looked at, I wish I had it written down. Basically, they looked at imaging findings of people that didn't have any pain mm-hmm. in their spine, and compared it to people that do have pain in their spine. And they were finding that these pain-free individuals that didn't have any injury, didn't have any pain, they came in, I'm healthy, I'm fine, that they had a lot of these same degenerative findings, of abnormal findings on their imaging that someone that has pain might have. Yeah. And so they used to always say, oh, you have a degenerated disc on your MRI, you have back pain, that is the cause of your back pain, let's fix that.
And then what I feel like people also do is they hear that. Someone tells them you have tendinitis, you have blank, and then they wear it like it's saying something about them for the rest of their lives.
Yep.
They're like, oh, I have a bad back, and then now I can't blank and blank and blank and blank.
And just telling someone that can make them have more pain.
Yeah.
They didn't have pain coming in, you tell them your back is messed up, dude.
Yeah. You've got,
and then they leave the clinic, my back is broken, my back is totally just
Well, it's exactly what I would think. If I had some back pain, and I saw someone and they were like, oh, you have degenerative disease. And anytime my back hurt, I'd be like sick to my stomach almost. Like it would be nasty to imagine that. And then I can see how that would be so easy to then just really pull back on doing anything, because any type of back movement, it's like, oh, it's my back's like, it can't handle it.
Yeah.
But it sounds like that's not the reality in most cases.
Right. So this study that I was referring to, I think it's by Burjinski et al. From 2012 in the Journal of Radiology, I think it is. I don't have it written down, but I can get it for you. They broke it down by age range, and for degenerative disc disease specifically, because this was the most prevalent finding, if you're over 40, more than 50% of 40-year-olds have degenerative disc disease.
More than how many?
More than 50%.
Okay, so most people.
If you're 40, don't have any issues, more than likely you're going to find degenerative disc disease. If you're in your 70s and 80s, it's closer to 80 to 90%. So really, what we've labeled as degenerative disc disease, because that's how we used to label these things, is look at a change on an image and then give it a label. It's more like wrinkles. It's more like the aging process in your back than it is an injury or some sort of problematic issue.
But now I'm curious, so what are the other 50% or the other 20% at age, what are they doing right? Or are they getting lucky? Or, because is it something where it is an issue and it might or might not cause pain?
Right.
And we should avoid it. Like, so what are the other people doing right?
That's a really complicated, difficult question to tell you. There's a lot of factors that go into it. Your genetics have a big part of it. Your activity levels have a big part of it. Your injury history does have a big part of it. If you have had acute disc herniations or you've had issues that will speed that process up. And I should mention also that while there's a lot of people that don't have pain that have these imaging findings, when you break it down into what percentage of people that have these imaging findings have pain versus people that don't have imaging findings and have pain, the people that have imaging findings are more likely to have pain than the people that don't. So it's not to say that it has nothing to do with your pain and it's totally out of the blue, but there's this gray area of people that have the same imaging findings and don't have symptoms. And so that's where having pain and having symptoms and having these imaging findings are two separate issues that are very, very loosely correlated. Yeah. But there is a correlation.
Yeah. I know we're talking about one specific example, there can be a million.
Yeah.
But is that something that can regenerate? Or is it, once you've done that type of damage, you've done it, and now it's managing that damage?
That depends on the tissue that you're talking about and the level of degeneration, as you want to say, but what we know is it's closely related to aging. So in terms of degenerative disc disease, which again, misnomer, it's as you age you get more wrinkles. As you age you get more aging discs. You get older discs, and older discs are stiffer, they have less fluid in them, they're thinner, and that's what we always used to say, that's a bad guy, that's a problem. Well, that's just getting older, and there's not really something that you need to be concerned about. Having that finding is not something that you can really necessarily prevent.
Yeah.
Now we think that you can slow that process and maintain a healthier functioning body by using your body and moving it appropriately and frequently and maintaining healthy lifestyle. But in terms of, what can I do to make sure my discs don't degenerate? We don't have that information yet. We don't know. We haven't figured it out that well.
But I think we can guess, learn how to brace your core the right way and quality movement as much as possible is probably safe to guess that that's probably on the right side of things.
The best thing that we can say is movement is better than non-movement. people that are active.
Sorry to interrupt, but I think that's key too, because people, their back hurts and they tend to move towards non-movement.
Correct.
So I think it's important for people to really know that, like, movement and blood flow and these types of things are more important, especially movement. And you're talking about the lifestyle factors that make you age slower. And it's like nutrition, sleep, movement, and exercise. All of these things are like huge on those lists.
Yeah. So let's say, basically we're looking, even if we're looking at specific physical therapy exercises for your low back pain, when we look at all of the literature, there's not a consensus. There's people that you go to and they'll say, you need to work on core strength. There's people that'll say, you need to work on back mobility. And people will do back extension mobility specifically, is very common. That's the McKenzie method. There's another method that they specifically work on back flexion and work on improving your flexing ability of your spine. There's people that say you need to work on your coordination. And there's all these different schools of thoughts. And these schools of thoughts came about because all of these people get results.
Yeah, and that's what you tend to see is, like, when it ends up being just different contexts. And it's like, if this person's saying this and it works, and this person's saying this and it works, then it's like there's probably validity to all of it. And there's probably some common themes running through them that is the real thing that works.
Right. So two kind of ideas here that we can kind of hit on is, we know that generally exercise and activity, people that do some sort of exercise and activity when they're in pain and having an injury recover quicker and better than people that go to bed rest or do nothing. And so all these ideas that I've laid out are different forms of exercises that got people better, but none of them get every person better.
Yeah.
So activity is better than nothing. That is very solid. We have lots of evidence behind that.
Yeah.
And then the other concept is, when we're looking at these research studies, they're looking at large pools of data and playing with percentages, right? They're playing with averages and, well, this treatment helped 50% of people, this treatment helped 35% of people. That means this treatment's better.
Yeah.
But what
unless
about
you're that 35%.
Exactly.
Yeah.
So there's a term that we, in research studies, you'll use N equals is the number of research participants. So big study, N equals 1,000, 5,000, 100,000. The bigger the number, the more data you have, the better the study is, what we've kind of always thought. But when you're working with Kyle, it's N equals 1. And if I'm treating you with stabilization exercises, but you're in the group that would respond better to extension exercises, you're not going to get results. And so that's where it becomes very challenging, and where there is no, this works for everybody, other than exercise. Right? Movements and exercise works pretty much for everybody. But that goes with specific types of exercise are highly variable from person to person based on your beliefs and your experience with exercise. And same thing goes with different types of pain relief modalities, like pain medicine, ice packs, hot packs, massage, hands-on treatments, acupuncture. All of these help some people. All people find, oh yeah, that feels really good when I get acupuncture done. You have another person who hates needles, don't ever send me to the acupuncturist. It was miserable, it was torture. And so again, it goes down to everyone has their own personal response. And that's why I want to do what I'm doing now, where I'm working with one person at a time, where in the clinic, because of insurance reimbursement rates and just the volume that has to be seen, you're seeing 2 or 3 people at a time. And so I don't necessarily have the time and the ability to give everyone that N equals 1 approach and figure out what your approach is going to be.
Exactly, and that is absolutely huge. And another really cool thing about how you do it, because it's everything. Like, we want it to be black and white, and we do this and then this works, but it's all guess and check. And the reality is, y'all and me just coaching, we get really good at guess and check. And we know exactly like you said, we know the most likely thing, and you can look at somebody and get more information. It's like, okay, we know the most likely thing here, let's try, but we also know that, like, we're not going to get married to this thing. And it's like, if that thing's not working, it's like, we're going to move over here. Like, we have a pretty standard way, and we've talked about this, about how I like to teach bracing, squat, push-up, jump, and how that links to everything. But that's just our starting point. Because we know if I tell you to squat like this, depending on what you end up doing, we're going to make adjustments to that, or however we say it resonates differently, yada, yada, yada. But it's just getting real good at guess and check.
Yeah, that's a lot of what I do in terms of exercise prescription is a little bit trial and error. Let's try something, because I've seen a lot of people that have your condition and your body type, and when I'm talking with you, I get an idea of your experiences, and we can have a pretty decent idea. We're going to try this approach and tweak it from there. And there's a lot of, some people, first visit, first thing we try works perfectly, and they're feeling better immediately. Other people, it takes a couple of sessions. It takes some time to identify what works for that person in terms of the type of intervention that we do, and also the dosage and the intensity, which I'll get into a little bit with you.
So what I'm hearing from you, which I really like, because this is how I kind of view what I do too, is I'm hearing a coach and not an expert telling you something to do. So there's some people that I'll call them not coaches, I'll call them trainers. What a trainer does is they tell you, if you do this, you progress to this, and you progress to this, and then you can do the thing. And if you can't do the thing, you did something wrong, go back, do this, do this, do this. And a coach has that plan, and then as soon as they see that something's not quite working or something's not resonating, it's like you're holding their hand, tweaking it the entire time. And so like no two people running through the process are going to be the same. And every now and then you get someone where it's like, oh, that worked perfectly, awesome. But most of the time you have people running into the roadblocks.
For sure.
So it sounds cool, because it sounds like that's what you're doing with people, is there. It's like if you're following an online thing, there's no one there to tweak it for you, and that kind of stuff.
For sure. I consider myself in some ways a rehab coach, or coaching you through pain and injury and how to navigate those things. So, a physical therapist, a lot of times we consider ourselves experts, like I said, in movement, and specifically in movement dysfunction is what people will say. So movement dysfunction, that just means movement that's not functioning properly and not moving as it should. Now, this is a traditional model, and I've been on this road for a long time. We're movement dysfunction experts. We're really good at identifying when you're not moving correctly. But we found that correct is variable from person to person. And so it's really, again, looking at bell curves, and we're looking at, okay, most people function in this way, but there's people on this end of the spectrum, and there's these people on this end of the spectrum. And so really, rather than considering someone having a movement dysfunction or it's problematic, I try to look at it, not everybody does, but as a movement dysmorphia, which just means it's just unusual. It's just different than the norm. But not labeling it as problematic necessarily. It's only problematic if it's giving you pain, or if it's causing an injury, or not limiting you from being able to do the things that you want to do. And
so what's to stop somebody from identifying as being on the end of the bell curve and saying, "Oh, I just move this way because this is how I move," when the reality is, it's very few on the ends of the bell curve, and obviously it's also very few right in the middle. There might be zero right in the middle.
Exactly.
So how do you get? Because an issue I see, and this is kind of the same thing. Like, I have tendonitis, therefore I can't blank. So how do you balance the giving people the confidence to know that, like, with my body type and this is okay to move this way, versus it sounds like you're making an excuse and you're not moving your technique towards the direction where it can get, because you're trying to just accept where you are because that's who you are. So where's that? How do you balance that?
That is a challenge, and so that is kind of where we're talking about. What we're really talking about here with technique is most technique is founded on biomechanics, right? It's okay to optimally lift this weight in this way, a deadlift. I'm trying to optimally lift the weight from the floor up to my waist. There is a way to do it that puts your joints in the best advantage to basically have the maximum potential, right? If you lift it in this mechanical way, your likelihood of being able to hit the highest peak for yourself is the greatest. So when we're looking at biomechanics, that's what we're really looking at. When we're looking at whether someone is safe and healthy, biomechanics become very loose, and this is where there's a lot of that opportunity where, okay, well, maybe that becomes the question. Okay, are we fixing our biomechanics because we're trying to hit our PR and we're trying to get 1% better than we were with our lift, or are we adjusting our biomechanics because we're worried that it's going to injure us, and we're worried that it's bad for us to have a slightly different biomechanics. We don't have data to support that it's bad for us or unhealthy for us to move in our different ways.
Yeah.
This is so rather than focusing again, when we're looking at peak performance, we're going to try to modify our mechanics and maximize those mechanics. But if we're just wanting to be healthy and move comfortably and feel well, it's really more about building up their tolerance to that motion and building their capacity in whichever way they're going to do it appropriately. So someone might look really bad. For instance, the heaviest deadlifters in the world lift with a rounded back. They get right, not maximally.
Yeah,
not maximal. They're not lifting, all the way over here for their max deadlift, but they're also not perfectly aligned. They're getting some flexion in their spine. And if you're setting the world record for the deadlift, who's to tell you that what you're doing is incorrect? But those people have trained that particular slight flexion in their back over years of dedicated time to using that particular technique consistently, that they've built up their body's ability to do it in that way. Now, could that same person lift 5 more pounds if they corrected their form slightly? Maybe. Maybe they could.
And that was the argument I was about to make, is some of the best deadlifters do it with neutral, and so many deadlifters are lacking mobility. So hip mobility, they can't get down there. And it might not be hip, it could be posterior chain, whatever. They can't get into a bottom position without it being rounded. So I don't want to give them the free pass and say, this is okay for you to ignore it as long as you just build it up strong. Because if that, in my opinion, if they would have taken the time to improve their range of motion and improve their leverage and start positions, then it's like, because to me it's not all about getting hurt, even though that's a big part of it. It's like with better leverages, it's like, man, I just think performance could go up a lot. So we had a gymnastics coach in here that taught super high level gymnasts. He taught a bunch of people at UT, and his comment was always, you can't look to the best gymnasts in the world for technique. You have to look to the kids, because by the time the best gymnasts in the world get there, they've been injured, their wrist is messed up, so many things have happened to them over and over and over again. By the time they get there, their technique is highly dependent on them resolving all the issues that they had to, where the kids' technique is kind of their clay. You can mold them exactly how you want, so they're ideal, and then they have to start dealing because of injuries and things. So I guess that's just the thing I worry about. But also, I don't know that for sure, that you clean up their range of motion and mobility, they do lift better. I don't know that, but that would be my assumption, and of course I could be completely wrong. But I do feel like a lot of people are using it as like a free pass of, I don't need to work on this because, or I haven't been hurt yet, so this should be fine. And I kind of look at it like, you might be fine for 6 months, 10 years, whatever, but to give yourself the best chance of being a super high performer now and being able to move when you're 80 plus, that taking the time to resolve those issues and prioritize that, the techniques that we think are better and more optimal for performance, but also for longevity, does have a benefit.
So performance for sure. We don't have the data to support the longevity or the reducing your risk of injury claims. Those have been founded for a long time on assumptions, very common assumptions. But when we tease out who's more likely to injure themselves, someone lifting with a neutral spine, someone lifting with a rounded spine, they're actually not a huge difference when you actually look at the studies that are following people with these different techniques. And so it's kind of something where 90% of us are going to experience low back pain in our life. So it's kind of, okay, so did that person experience low back pain because for 10 years they've had, suboptimal lifting technique that didn't bother them all? Or was it just their time and they're going to get low back pain no matter what they do?
Yeah.
And so this is where it gets really gray, right?
Mm-hmm.
We don't have a solid answer to it.
And I think that's
but how do you
good
respond
because everything's
to that,
gray.
right?
Yeah.
So for me, prevention, you can only do so much prevention, and you'll go crazy trying to do everything you can to prevent things from happening.
Mm-hmm.
It's more about acceptance that things will happen, whether you're active or not. If you're active, they happen less often than if you're not active, like we said, but you can have perfect technique. You can do everything exactly right and have exactly the right form and still get injured, and still have things happen.
Yeah.
And so that's not to say throw all technique out the window. That's definitely not what I'm saying.
Yeah.
But we want to kind of accept that people are going to have pain, and then sometimes it's kind of like, gotcha. You had back technique, and I knew this was going to cause you a problem, and now you have a problem, so now listen to me and change your technique. When really, okay, you had an injury. We can correct your technique for now to make it feel better while you're injured and while you're sensitive and sore, and because maybe your specific technique is now irritated from what you were doing. But when you're feeling good and feeling healthy and you're taking care of your sleep and your rest and your nutrition and you're moving well, you have some laxity there. Okay, so you don't need to be so rigid of this is the only way to do it when you're feeling great. When you're feeling sore and you're feeling injured, or you're going for maximum effort, maximum, max reps or max weight, this is when mechanics matter the most. But if you're going lower intensity, or if you're feeling really well, the threat is not as high, there can be a little bit of laxity there, and we can't say that it's predictive of whether or not you're going to have an injury.
Yeah.
Not highly predictive.
Yeah.
Now, again, we do have data. If you're lifting with a maximally flexed spine, we're talking, if you're on the very ends of the abnormalities and you're just lifting with terrible mechanics that have minimal mechanical advantage, then you're asking yourself to get injured.
Yeah.
But if we're going from perfect to 5, 10, 15, 20, who knows what percentage, but a percentage off of ideal and perfect, you could function there just fine most of the time, and then it's really not going to cause you an issue.
Yeah.
It's more about, for me, I look more at their dosing for these kind of issues of, okay, was it, so pain and having an injury with your exercise routine, maybe that's more of a symptom than it was the cause of your issue. And so, there's a million different reasons why you can start having pain. It's not all physical, it's not all mechanical. They can have, just having more stress at work can cause more pain, just having, depression can cause you to have pain come on. Having some memory of having pain, in the past can cause you to have pain.
Being allergic to a food and having inflammation.
That can cause you to have back pain. Like we said, just like you can go to the doctor and they can tell you, you have degenerative discs, and you walk out and your back hurts. You can be deadlifting just fine, and then someone can come up that's well-intentioned and tell you, this is terrible form, you're going to hurt yourself.
Yeah.
Their back might start hurting because they have that now subconsciously in their mind that, am I lifting correctly? Should I do this? Should I do this? I don't even know if I can deadlift anymore because I know I'm not doing it right. And then that to me can become a bigger problem than supporting this person in the claim that your body is strong and resilient and adaptable, and it can overcome things over time if we're patient and persistent and give it the right stimulus.
Yeah, I think that's good. So, because I think we're saying similar things. So I'll just relate it back. So there's a book called How Champions Think. I think that's what it's called. And it's awesome. It's a golf psychologist. But he has, one of the ways he coaches is he's got some people that get frozen with their golf swing technique. And they get frozen. And so he's real big on, at some point, you have to be confident enough to know that your swing and your ability is good enough. Let it fly. It's time to go. Forget about it, swing, make it happen. So I think it's a mixture of these two things of knowing no one's ever going to be perfect, but being hyper focused on improving your technique as much as you possibly can, and through that range of motion work, mobility, soft tissue, where all these things can help improve that. But then when it's time to lift, you got to put all that out, do your best, and send it. So then you can kind of have this mix of continually trying to improve your technique, but also at the same time not letting you hold that back. Because I know for me, I tend to slump on my right side and it makes me face this way. So I have alignment issues, and especially when I'm hyper-focused on it, it's like I almost can't lift anymore because the only thing I can feel is myself being out of whack, and it drives me nuts.
Yeah.
And that's where I have to remind myself that, like, hey, it's an issue, keep working on it. Don't let that just stick around forever.
Sure.
But for right now, you're trying, it's good enough, time to go, let's go.
Yeah, I think that's exactly right. Like, okay, I have this optimal technique that will long-term increase my ability to do XYZ, to drive the ball further, to lift the heavier weight. But at the same time, the technique I have now is safe and secure and is appropriate to use in the meantime as I try to get to that point.
Exactly.
And I don't have to stop doing it
Yeah.
or hold myself back because I'm not at this point yet.
Yeah. And I think another thing to relate it back to CrossFit in the gym is we've interviewed a ton of coaches, and what you can always tell a brand new coach, because they all say the same thing about the snatch. It's like, oh, nobody should be snatching until they're perfect with a PVC pipe. And it's like, how long is it going to take somebody, especially someone with no experience with a barbell, to become perfect with a PVC? That's going to take 10 years. I'm not perfect with a PVC pipe.
Yeah.
It's like, so when do I get the barbell?
Right.
And so there is that little bit of they need to be good enough, but also they're never going to be perfect. But they also need to be trying to continually define that threshold and find one thing that they can push to that next level. And it's like, it's fine, but let's find one thing to push that to the next level. And that's what we talk about a lot. So just to update them, that you're not only a physical therapist in our gym, but you're a coach for us now.
That's right.
And so working in those foundational things into these highly technical lifts is really kind of the key.
Yeah.
But you're never perfect, but you should always be, it's so hard, you should always be trying to improve your technique, knowing you're never going to be perfect, and also knowing at the same time what you've got is good enough. And it's a hard balance, because if we go too far the other way, is your technique is good enough and then people stop working on it, it's like, I know how long, I don't know, every day I work on trying to improve my ability to move and brace my core, and I'm getting better and better and better, but it's like this, it's a lifelong journey and then I'll see a video and my right big toe is up, and it's like, these aren't things that are major, but they will bring on improvements and help me fix things if I focus on them. And that's not to say the way I do kettlebell swings when my right big toe is off the ground is going to get me injured, which it might, but it probably won't. But it is, hey, it would be better if I could learn to keep that sucker down. And it is that weird mix of pushing yourself to try and be perfect, knowing you're not even ever going to come close to being perfect, and also knowing that all the mistakes you're making right now are fine.
For sure.
Yeah.
And this becomes really what I coach people through when we're talking about recovering or dealing with pain or injury, because a lot of people are quick to assume or assign blame to either the technique or the lift that they were doing, or some sort of specific blame to the cause of their problem. And in reality, that might be part of the truth, but there's a lot of factors that go into this. You can only control a few of them, you can control a fair amount of them, but you can't control all of them. So don't worry about, well, I'll never be able to do that because I have longer legs. I have a longer torso, so I'm not ever going to be good at X, Y, or Z.
Yeah.
Your body you can train your body to adapt and become better at these things over time.
Yeah.
And so whether you're working on maximal performance right now, or you're just trying to feel more comfortable and better and manage any sort of pain that you're having, or recover from an onset of pain or injury that you're having, your body can adapt to those issues and to those differences over time if you're smart about it and you're persistent and patient with giving it what it needs.
Yeah. So how do you, if you were an athlete, how would you figure out when is it time to accept a possible limitation of your body with technique or when is it time to just keep pushing and let's keep trying, and I'll never accept it, but I'm also going to accept it at the same time. So I guess, I don't know if I'm explaining that well, but someone who is rounding their back in a setup in a deadlift.
Yeah.
When do you say that's okay? Or when do you say keep working on it? Does that make sense?
So for me, if someone is happy with it, they feel comfortable with it, they feel strong and stable with what they're doing, and you're seeing progress in their performance over time, so they're able to lift heavier and heavier weight without degradation of that technique. They're able to be consistent with their technique even as the loads increase. I kind of give them the green light.
Mm-hmm.
If they start to have pain or they start to have major soreness as a response, their body's not tolerating that load anymore as they get to higher loads. Okay, well now we might need to tweak things to be able to up the load.
Mm-hmm.
And our strength gains are not linear, right? It doesn't happen on a consistent basis. So there's going to be these plateaus, and you might even lose a little bit over time at points. So that's where it becomes challenging to really address this. But you kind of look at the big picture and say, okay, well, do you feel good doing this lift? Do you feel confident doing this particular technique that you have? And are you making gains? If you're not making gains, if your body's not recovering and not responding well, and it's sore after every workout, you're having pain after every workout, you're having to drop down the weight that you're doing over time consistently, one week, something like that, okay, we can work through that. Mm-hmm. But if it's consistent over time, I'm not getting better at this, I'm getting worse at it, I'm having a harder time, it's becoming more uncomfortable for me, that's where I'll really say, okay, well, let's really hone in on your form and your technique.
Yeah.
But if they feel comfortable with it, they like it, they're happy with it, and they're pushing themselves hard and their body's recovering and responding well to it, I'm tending not to mess with it.
Yeah.
And because again, sometimes if I mess with it, now they get in their head about it, now they're thinking too much about it, they're getting worried about it, now it's feeling worse than it was before if I hadn't said anything, and they're having more issues. And they're asking, is this right? Is this right? Am I doing it right? Should I put more weight on it?
Yeah.
Well, if I hadn't said anything and you just kind of, well, how does it feel? It feels light. Put more weight on it.
Yeah.
So that's where I always I'm hesitant to say anything if everything is going well for that person.
Yeah.
And that's just my approach.
And I think, and correct me if I'm misunderstanding it, but I think you're talking about narrow ranges. So if a brand new person who's never worked out before, came in and they liked to lift, that was their deadlift.
Mm-hmm.
Like you would cue them out of that.
Right.
You're not going to just let them go, because you can take a new person that deadlift the bar like this, they could max out that day. Let's say they do 100 pounds. They could come in next week, they could probably do 150 pounds already. So that would be gains.
Yep.
But that would be a technique because that would be too far to the extremes. It's like, okay, well that's not acceptable.
So that's an exercise I prescribe for people, right?
Like a Jefferson
curl.
But
there's a limit to that.
If
it's
you're prescribing
be much lower than a deadlift, right? And you can recognize and teach that person, well, that's not a deadlift. That's a different exercise. What you're doing is a different movement. It's loading different tissues. So that's not hitting our goal of strengthening the glutes and the quads and the legs as much. It's purely isolating the back, which in a rehab session or as someone whose back is limiting them all the time, I love prescribing that exercise. That's an exercise I'm going to go to and make sure they understand you probably, at best, maybe 50% of your deadlift with this weight is probably what's going to happen for you. That's when they're not doing the right thing, they're not achieving the goal, or they're the grossest of the gross. Like a big common one is with knees and knees turning in on us. There's people that have, I don't know if you know Kevin Durant, the basketball player. He's the best in the world, second best in the world, depending on if you like LeBron or not. His knees bang together every time he shoots a shot. Try telling Kevin Durant to not let his knees come together when he shoots. He's like, but I'm the best shooter one of the best shooters in the world.
But I haven't Googled it. If we Googled Kevin Durant knee issues, would we see a history of knee surgeries?
He's never had a knee issue.
Never had any?
Well, don't quote me on that, but all his issues are I'm a Longhorn Kevin Durant
Yeah,
fan.
yeah.
All of this stuff has been foot and Achilles issues. He's not had any issue.
Yeah.
But he's not the grossest of the gross.
Yeah. But also when your knees come in, you know, the arch of the foot collapses, it changes the angle of the Achilles. So could those be downstream factors of constantly cramming everything in on the knees?
Our bodies adapt.
Yeah.
And so if he's been doing it that way since he was 5 years old, his body's used to doing it that way, and he's probably fine.
Mm-hmm.
And he's probably, if he has an issue, it's more he did too much shooting at one time. He increased the volume too quickly. Oh, he came back from an injury that he had, so he had to take some time off. His ability, his tolerance to jump shots went down.
Yeah.
He went back to jump shooting like he was healthy, and that caused irritation, caused tissue breakdown too quickly. And that was the issue, more so than the form that he did, but more the dosage was off.
Mm-hmm.
And that's, you know, the nuanced stuff. But
Yeah.
typically for me, the first thing is dosage. Did you do too much too quickly?
Yeah.
Did you ramp up too fast? So if they're doing the Jefferson curl and they progress their Jefferson curl appropriately, it's not going to give them problems.
Yeah.
Now, they might get to a point where they can't lift heavier weight on it, and they say, well, A, you're not deadlifting. You're not going to, you know, pass the deadlift standard.
Yeah.
And you're going to have a limit on how much you can do. At some point, you just have a genetic capacity to do a Jefferson curl that's lower than a deadlift. So we need to switch to the deadlift. You know, get your technique closer to resembling a deadlift, so your numbers will continue to go up.
Yeah.
And you'll be strengthening other areas other than just your back, because we want to strengthen other areas.
Yeah. And I think that's key too, and because the Jefferson curl, I'm a fan of the Jefferson curl, but it's also just not the most effective way to pick weight up off the ground.
Sure.
The deadlift is.
Sure.
And the deadlift is more effective than the stiff-legged deadlift.
Sure.
Depending on what kind of range of motion you've got.
Right.
And so when it is, when we are trying to push people towards certain techniques, it's not to increase their bar weight. For me, I'm trying to increase their skill transfer to the real life or whatever their sport is and all of that. And so that's why, teaching people to learn how to move with that neutral spine just to kind of optimize positions where that kind of comes in. And because if the standard in powerlifting meets is you take the barbell from the ground and you stand up with it. And you can do it any way you want. So you can Jefferson curl
you just
if
won't
you
win
want.
The competition.
Exactly. So I kind of look at technique as trying to optimize performance. And if that person gives themselves too much leeway, then they're just leaving a big gap in potential. And it's like they can get better and better and better. Like if you just only Jefferson curl, you're gonna keep getting better at the Jefferson curl.
Yeah.
And maybe infinitely until, you know, obvious you've reached your personal potential.
It might be I have videos of people doing 500-pound Jefferson curls.
Yeah, exactly.
But
so
they're extremely strong people that train the Jefferson curl.
Yeah. And so if the goal is ultimately get our bodies to move really, really well, especially in these real world situations, then that's where the coaching out of the Jefferson curl technique for a deadlift. So that's where for me, the specific exercises do come in.
Yeah.
That's a Jefferson curl. We're deadlifting. A deadlift is like this because of blah, 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 blah.
Well, so another kind of saying that we might use is that we're training movements, not just muscles.
Yeah.
And the muscles get trained as a secondary, but we're focusing on the movements.
Yeah.
Well, I would like to have someone that has options to move. Okay, to pick something up, I can only do it with perfect deadlift form. And because sometimes if you're picking up a sheet of paper, I can Jefferson curl a piece of paper. I can do a single leg deadlift to pick up a piece of paper.
Yeah.
I can squat to pick up a piece of paper. And even more than a piece of paper, right? If I can Jefferson curl 150 pounds, not to just keep going to Jefferson.
Yeah.
I don't Jefferson curl everything all the time. But if I can Jefferson curl 150 pounds, then if I'm picking up a 50-pound bag of mulch, I'm confident, I know that I can Jefferson curl that weight.
Yeah.
If my knee was bothering me that day, and I'm like, I know it's better to deadlift here, but my knee's been bothering me, and I'm not going to mess with that knee today, so I'm going to Jefferson curl this weight because my back can take it, and my knee right now cannot.
Yeah.
And so that's really what I like to have people understand is you have different options for different situations.
Yeah, I love the options.
And the options close down the heavier the weight is, right? So, or the more intense the situation
Yeah, or
is.
the more fatigued
the
you
more
are.
fatigued you are.
Or
okay.
the less range of motion you have. Your options narrow.
Yeah, if you don't have the flexibility to achieve certain movements, whether that's just over time, you're because of your sitting posture all day, and now you're losing some mobility.
If you can only wide stance, low bar back squat, because you don't have the ankle mobility or the hip mobility to do a little narrower, then it's like barbell number wise, you're going to be fine, but options in real life are going to be limited.
Right, so you do want to train those options, and then recognizing that there's going to be different options that are going to be best for different situations. The same person is going to prefer different options on different days, different weeks, different months. So, you might for a long time feel like I'm very comfortable with a standard conventional deadlift. And then one day you have a hip issue come up, and all of a sudden the sumo deadlift is much more comfortable for me.
Yeah, and move a couch. What is moving a couch is a sumo deadlift.
Right. So being able to have that proficiency in all these different forms of movement is what I really like to coach people up and say, is this a problem? Well, it's only a problem when it's a problem. And when it's not a problem, this is a good option for you when you just want to do something different sometimes. Yeah. Because my back is sore, so I'm going to bend with my knees. Or, my knee is sore, I'm going to bend with my back. Being able to have that. And that's where working with a physical therapist really is more of a long-term kind of a relationship building. You can't teach someone all this in one day.
Yeah.
It is, like you say, it's coaching them for life and understanding different situations are going to require changes and different activity modifications and different twists. And, this technique was working really well for me for a long time. But right now, I tweaked my back doing something unrelated, and now my back hurts when I do that technique. Well, if I change my technique, this feels better for me. Well, just do this for now. Yeah. And we'll get back to that as your back starts to heal and starts to feel better. Yeah. And so that's a lot of what I do is try to offer options, help people identify different options if they need to, or if they need to just identify, okay, you have a limit on your overall capacity. You're used to being able to deadlift 300 pounds. You've had an injury. Your total deadlift capacity right now is 200 pounds. Don't be stubborn and try to deadlift 300 pounds. It's going to further irritate you. And again, tissue damage and injury, maybe. It's more about sensitivity. And you're sensitized, you're irritable. Your body is getting highly irritated with that particular movement right now. So let's find a way around it, or let's put limitations on how much of that movement we do.
Yeah, and that's cool. And I do think a lot of people get too caught up in being a complete robot with the spine. Yeah. But it's like there are tons of sports out there that require a flexed spine. Right. So it's not like this, if you flex your spine, you're dead thing. So I do like having the options and the ability, and then putting into context when you're doing something, like why are you doing it. I think that can go super, super far. And just with like squatting and everything, having those different options, what I like to do is, in my head, I don't have like a back squat max, because if I was going to truly back squat max, I'd probably go low bar, I'd probably go wider stance, I'd go exactly to parallel. So then I could do a low bar a little lower, I could do a low bar 3/4, I could do a low bar with ollie shoes, I could change my stance around, I can do a high bar with feet straight, I could do a high bar. So I think what happens to people is they think deadlift and they've got one number. Yeah. And so then they're only ever going to deadlift that way, which even world-class powerlifters, strongmen, athletes will deadlift in a variety of ways, but then leading into their competition, they get much more specific and use their competition lifts. Right. But they're using a bunch of variants. But they'll have their numbers for each of those options. So I feel like in the more amateur CrossFit world, people get real dialed in, because it's like in CrossFit you feel like there's a lot to learn, but really there's not. we're squatting, and typically people take the exact same stance every time. And yeah, we might move the barbell from here to here to here. Clean and snatch, we're using usually the exact same technique for those two things over and over again. So there's really not a lot of variation where people could be playing around with different feet positions a little bit more and find out what is optimal for you within this range of like trying to get the best performance out of it, but just knowing that, hey, if we put our feet straight, that might change these things, but it's a different exercise. Developing more capacity in different positions. If we turn them out, that might do this and this and this, but again, developing more capacity if you ever find yourself with your feet turned out, type stuff.
So for me, just personally when I'm training, I make a point of training it with those different positions. And I want to try working on a wider stance for the next couple of weeks, for the next month or so, because I recognize that I have a pretty narrow stance. I'm pretty used to a narrow stance, but I just think it would be fun and cool and interesting to be able to have a strong, wider stance.
So developing the options.
Developing those options, playing with it. Now again, I'm not going to my max weight, my even 80% weight necessarily. I'm going lighter weight and just seeing how that feels and progressing.
Yeah, because as soon as you move your stance, now you have a new max.
Right.
It's a different lift.
Exactly, for sure. And it's something that you haven't trained it, so there's some carryover between techniques, of course, but if you haven't trained this particular technique, then your load capacity with that technique is going to be lower than it is with a different technique. But I like to play with that stuff. So I wanted to do a little bit talking with you about pain science a little bit, if that would be okay, and sharing a little bit about how I use some basic rudimentary pain science and to address injuries and recovery and kind of stuff like that.
Yeah, awesome.
So the first thing that kind of goes with what I've already been talking about a little bit is hurt does not equal harm. Okay, just because something doesn't feel good doesn't mean that it's causing tissue damage right now. Okay, or just because something is hurting you, a lift or whatever movement is hurting you, doesn't mean it's bad to do. It doesn't mean, and it can, not that it can't, but it doesn't always mean that it's harmful. And in a lot of situations, if you're doing something controlled, if you're doing something with a load that you are comfortable with, like if you say, I know that I can deadlift 300 pounds, we're doing 150 pounds, it's safe, okay? And it's controlled. And even if it hurts to do it, very likely that it's more of a tissue sensitivity and irritation than my back just broke, okay? So there is a correlation, but it's a fairly loose correlation between actually hurting and having harm.
So if you are lifting and you are having pain, what would your recommendation be for that session, but then also be maybe after the session, the next few days, that type of stuff?
So the first thing, I even have a flowchart that I've gotten that I didn't create, but I've adopted from another therapist that kind of says how to address pain in an exercise session. Okay, you do a lift and you have pain. The first thought is this a new lift I've never done before, or is this a higher intensity I've ever done before? If yes, okay, then probably go back to the other form that you're comfortable with. That's the first thing I would try is, well, does it hurt if you lower the intensity? If I drop my load down from 200 pounds to 150 pounds, does the pain go away? Yeah, okay, it's a load sensitivity issue. It's not an injury. An injury is going to hurt pretty much no matter what. And so if you can just decrease that load for the day and it goes away, or you can tweak that technique going from that narrow stance to that wider stance, and that pain goes away, do that for that day, don't sweat it, and then readdress it the next day or two. Then, now if that doesn't matter, it doesn't matter if I lower the weight, if you're having to significantly drop the weight to where it's not a workout anymore, it's not worth doing the exercise anymore, then that's a different issue. But if you can cut 10, 20, 30% and still feel like you're working yourself and the pain goes away, we're good. But if it goes well and you're able to adjust and find something that works for you, then how did my body tolerate that and recover afterwards? I kind of use a 24-hour recovery rule, basically. So if you have an onset of pain during or after a workout, we'll say, does it recover fully within 24 hours? You're probably fine. keep monitoring and see if that becomes a recurring issue. But you don't need to change anything. Don't jump up in intensity. Keep that intensity that you successfully recovered from, but you probably can continue with that. If it's 24 to 36 hours of recovery time, maybe consider lightening the load a little bit more and seeing how that does. If it's 48 hours to 72 plus hours, it's multiple days that I was in pain and having soreness, debilitating soreness, not just DOMS muscle soreness, but different, this hurts pain soreness, then that's okay. That was something that was too much. You did not tolerate that load and that workout, and we really need to consider taking a break, really modifying our technique, or really bringing down our load until our body is tolerating that better. Does that make sense?
Yeah. So I think what you're saying is, if I'm lifting and I'm feeling a little achy, I'm not just going to continue up to my highest intensities. Right. I'm going to find an intensity that pain isn't debilitating.
And doesn't get worse.
It doesn't get worse. Yeah, so it's okay if it feels a little dull, but not like big pain. Big pain means keep going down or change what you're doing.
Yeah. So everyone's pain rating scales and all that kind of stuff is highly variable. So it's very hard to say, oh, if it hurts more than X or Y, then don't do it. But typically I just kind of leave it. If it's acceptable to you, tolerable to you, and it's stable, we're good. If it's increasing with repetitions or over time, probably not ideal. Or if it's a severe sharp pain, or you consider intolerable for you or unacceptable to you, let's switch things up.
Yeah.
So, I might throw out a less than a 5 out of 10 pain. For me personally, as someone who's very knowledgeable about pain and very comfortable with navigating painful issues, where I'm not afraid of lifting through pain a little bit, because if I do mess it up, I know exactly what to do for the next week or two to be okay, and I'll be fine.
Yeah.
Someone who doesn't have any expertise in that might say, I don't want more than a 2 out of 10 pain.
Yeah.
But that's kind of very individualized. But yeah, if it's stable and tolerable to you and you're still performing well, then I'm okay. I'm okay with it for that day.
Nice.
And then adjust, see how it goes after that day. How it already wrecked after that. Okay, well then we need to look at something. Again, being totally, it's probably more of a sensitivity issue, like a blister kind of an issue, or a soreness, than it is I broke my bone. Most people don't have I broke my bone lifting
and
issues.
I kept going.
Right. They don't keep going, And I mean, those things those almost always happen at max effort, right? If you're not going at max capacity, max effort, people don't have that many lifting injuries that are actually tissue damage. Again, they can have the onset of pain often. And I think that people that are training and are working out and they're pushing their bodies a little bit are more likely to have fluctuations in pain and experience pain. But that's because their body's using pain as a guideline. It's more of a hot and cold thing, not a red light, green light kind of a thing. It's not pain means stop. Pain means pay attention, focus on what you're doing, and see if it's something that you need to be addressing. But it doesn't mean, pain, put down the bar, stop for the day, I can't go. You probably can. Just be smart about it. If you were planning a red line max effort workout and you're already in pain, drop that down to instead of a 10 out of 10 intensity, maybe a 6 or 7 out of 10 intensity. Still going to get a good workout, still going to be effective. Maybe it's not going to create maximum tissue adaptation you're not going to be the strongest you could be the next week because of that, but you're going to feel better and it's sustainable so that you can train for the next few days.
Then, later.
Versus, I worked out super hard today, but now I'm feeling terrible for the rest of the week and I can't work out again. So it's take a little bit off, sure, but it's all subjective.
And I like what you said, try something different. So personal story is I tend to have an overextension issue, and that does cause pain in my low back if I catch myself here. So if I'm doing good mornings overextended, it hurts and it feels like I'm going to snap in half. And as soon as I try something different, like really try and control my spine and not an extended way, pain goes away entirely. And so it's just and I think we're saying the exact same things, and I call that technique, but it's like, yeah, try something different.
Yeah.
And it's like, for me, it was like, oh, try something different. It was like, oh, but something that would classically be thought of as better, like brace better, and problem goes away. So yeah, that first place is looking at, if your knees hurt and they are cramming in, what do they feel like if they're stable?
Yeah.
Type of thing.
For sure. Yeah. If Kevin Durant says every time I shoot my knees hurt, okay, I might tell him, well, let's look at adjusting your knee position a bit and see. Now, again, I might first tell him, well, how much have you been jump shooting? Oh, I've been doing 200 shots a day.
Yeah.
I was doing 100 shots a day. Well, let's try 150 and see, does your knee pain go away without changing technique? I'd much rather change that aspect of things than try to mentally to change your form. It takes a lot more energy and effort and mental
usually a
brain
few
power.
steps back.
Right.
And when you're in the world-class arena,
right.
And you're getting paid millions of dollars, when do you take a few steps back?
When you're already as good as he is at shooting, he can take a couple days off of shooting and still be good. Or he's not going to take a day off. Yeah. But he can bring down his training down 20% and still be effective and feel better, and his performance will go up.
Yeah.
So going back to my pain science, I have a couple analogies I want to share with you. Okay, so I said hurt does not equal harm, right? And that's something I always like to circle back to, because we have to navigate painful movements and approach and test out painful movements to overcome them and desensitize ourselves to them in a lot of ways. So I like to use an analogy of experiencing pain. Again, is not your body feeling a tendon tearing apart. It's not your body feeling any specific tissue damage is occurring. That's not when pain gets sent to you. Pain is sent to you, basically, think of it as a fire alarm, like a smoke alarm. So there's smoke in the air. Again, it's not sensing there's a fire, it's smoke. You could be cooking and there could be smoke in the air. Mm-hmm. There's numerous reasons why a smoke alarm could go off. Your battery in your smoke alarm could have died. Mm-hmm. Just because the smoke alarm goes off doesn't actually mean that there's a fire, okay? So in the body, there's not just one smoke alarm though. Think of it like a bunch of thermostats. There's a series of thermostats, and they all have gauges like a thermostat that's meant to kick on if it gets too hot or kick off if it's too cold. Mm-hmm. And we have, in our nervous system is constantly monitoring all over our body temperature. It's monitoring the amount of pressure on the skin, on the bones, on the tendons, where there's measuring how much tensile load is through a tendon. It's measuring the amount of inflammatory markers in our blood. So there's a lot of inflammation in this area. It goes past a certain threshold for inflammation. Oh, that could be a sign of damage. Send a pain signal. Mm-hmm. But it couldn't be that there's not an injury. You just had an allergic reaction and there's inflammation there, but it's going to cause pain to pay attention to. Yeah. Or same thing with the temperature. Okay, if you touch me with this cup, I can feel that it's cool. Okay, but it's not painful. Mm-hmm. There is a certain temperature that if this metal was cold enough and I touch it, I'm going to withdraw because it hurts. Because it's too cold, my body recognizes that temperature is potential for frostbite, potential for skin damage, tissue damage. Pay attention. Mm-hmm. The thermostat's going to usually, not always, but if you haven't been injured, if you have healthy skin, healthy tissue, the sensor's going to go off before it becomes actually damaging. Mm-hmm. Same thing with heat, right? There's a certain temperature that's going to feel warm, hot, then there's a threshold that if we cross this threshold, it's going to hurt. Now, that threshold changes over time, and it's protective, that it's going to usually tell you to recoil before it actually burns your hand. Mm-hmm. Now, sometimes if something's hot enough, as soon as you touch it, it's burning. Like my leg, you can't see it anymore, but I have a motorcycle tailpipe. Oh. Well, I touched the tailpipe, I felt pain and I pulled away, but I touched it for long enough and it was hot enough that I actually burned myself before I can get the reaction to move away. Uh-huh. So it's not perfect, but that's basically what's going on in our whole body all the time. Is there's a bunch of little thermostats monitoring all the different stimulus that's coming in and determining, is that a threat, is that not a threat? Is that a threat? It's not a threat. That is a threat. Pay attention, pain. That's not a threat, ignore it, kind of a thing. And these thermostats, their sensitivity changes over time. So, and different people have different sensitivities. Mm-hmm. So your thermostat might be set to kick on at 75 and 65. Mine might be set at 68 and 72. Mm-hmm. And so I have a smaller window with which I can operate before I'm going to start to feel pain. Yeah. And yours might feel good today, but then you don't sleep well the rest of the week, and then yours narrows down, and now you're more sensitive to pain. You're more likely to experience pain with the same stimulus, the same actual potential to injure you, but it can hurt you more likely to cause you pain than it did earlier in the week when you had a good night's sleep. Sleep's not the only thing, but if you've had an injury, that's going to change. You're in an area that you've had an injury, you're going to be more sensitive. Your body's going to pay attention more in that area. And so that's really kind of what our body is doing when it tells us, when we get a pain experience, a pain signal, is some part of our body has crossed that threshold to where it's creating that stimulus. Now, the next part is to determine, is that stimulus actually damaging and actually something we need to pay attention to? Or is it a false alarm because, I'm just sensitive because I'm cranky and I'm in a bad mood and I'm stressed and I'm overslept and haven't been eating well and I've been working out really hard, and all these stressors are creating my body to be more sensitive right now than it was last week. My deadlift max has not changed that much. My body's actual tolerance and capacity to lift before it gets injured doesn't change that quickly, but my sensitivity to that stimulus can change in minutes. You can go from feeling it's very painful and very scary to having some exposure to that stimulus and realizing it's relaxing and it's not so bad, and tolerate it much better.
And you can feel that in warm-up a lot.
Yeah, exactly. So going into a warm-up and something bothering you, again, if it's a sharp thing and you've had a history of, I've injured this area recently, okay, pay attention. But a lot of times for me, that means we just need to warm up a little more, work it out a little bit more, be a little more gradual with getting into things. But your sensitivity will very likely be lower by the end of the workout if you program things correctly. So that's the fire alarm and the thermostat. Those are how we're basically sensitivity.
Yeah, and I like that because a lot of times people will have a nagging pain. But they're not injured yet.
Right.
You've got nagging pain.
Yeah.
So what we will typically see is someone will be like, oh, well, now they're out for a week. They went to go see somebody, and they're like, yeah, I've had this thing for 8 months. It's like, oh, you've had a nagging pain for 8 months, and then it got so bad that now you can't lift your arm, and now you're going to see Jared. And it's like, you should have seen Jared 8 months ago, or you should have talked to a coach so we could have given you some tips, help work through it. But I do feel like a lot of people, so I like the thought of the nagging pain it's the warning sign. Right. It's the, hey, get it checked out.
Yeah, get it looked at, pay attention to it, address it, don't ignore it.
At the
same time, it doesn't mean, it hurts, put it in a sling, don't use it till it doesn't hurt anymore, because as you've already mentioned, it's not necessarily a mechanical cause that's causing that, and sometimes it actually is a mechanical solution to make it feel better. And bed rest or total rest and total lack of use almost never helps. Only helps short term. Or if you've had a major injury, and we're pretty good at detecting major injuries through imaging or testing. We can tell when I covered a football game this weekend, and you can tell when I had 2 kids dislocate their shoulder. You can tell immediately. Had another kid dislocate their kneecap. All in the same game. You can tell immediately, but one of them had dislocated his shoulder the week before. And it had recovered. He had full range of motion, full strength. The doctor cleared him, and he played. And, that's aggressive. But they all felt comfortable with it, and it popped out again. He was not freaking out. He was calm. He's like, oh, it popped out again. But by the time we popped it back in for him, and we're on the sideline, he didn't want to take any Advil. We iced it because I kind of insisted that he iced it. But after he iced it, it felt fine, and he wanted to play again and didn't even have it in a sling. Another kid, same thing happened. It's his first time dislocating, which can be a little more concerning. You've never had that happen to you. It's going to freak you out. He ended up taking Advil, icing, and then being in a sling the rest of the game. And was like, am I going to be able to move my arm tomorrow? I'm like, well, your teammate recovered in a week, so you just don't know. But those are acute traumatic incidences where, okay, we know that you had traumatic injury to your shoulder. If it just kind of crops up out of nowhere, well, we can take it testing to see if you have some sort of cancer or fracture or infection, and those can cause those issues. But it can also just be stress and lack of sleep, or too much too quickly in terms of our workouts. We've been working too hard for too long without enough breaks, and we just need to bring that down 20%, not 100%. But that's where having someone to talk to about that and tell you, okay, before this gets to where you have to go down to 0% to feel better, you can feel better at 50% or 60 or 70% and not have to completely stop your workout. Because that's what people don't want to hear is I have to stop my workout. So that's why they don't do it. They don't want to address it because they don't want to stop doing their thing. And they want to continue to do it. And I like to empower people. Very likely you can continue to do it with a couple tweaks, with modifying our intensity or our frequency, or changing our technique for now to instead of a narrower grip, maybe a wider grip on your overhead motions is going to feel better for you, or opposite, maybe for you have a wider grip, try a narrower grip, and right now that feels better and it's not irritating and it allows my shoulder to get more less painful, less sensitive, and then when it's not sensitive again, go back to whatever grip you enjoyed and you felt best with and you feel strongest with if it's starting to feel better for you.
And and that goes back to the try something else. And so often we see, especially people with shoulder issues, we see they do everything like this, just everything like this. It's like, well, try something else. Let's try it this way, and we'll see how that feels. And so those technique adjustments along with that stuff, I think, you can see a lot of times it's like instant pain relief.
So you can think of that as, for the shoulder specifically, it's a good example of, in the skin, for instance, you've got blisters versus calluses. I think I've heard you say build calluses, not blisters. Did you say that?
I don't know, but I'll take credit for it.
I'll take credit for it. But you want to develop the calluses on your hands that can tolerate, that's positive tissue adaptation over time to that stress. Okay, we need thicker skin on our hands because we're using them more. And that's a positive. Now, people don't like it because it's ugly or whatever. People have these aesthetic views of it, but that's your body's way of responding positively to the stress that you put on it. Blisters is when it's too much too quickly. Too much stress, too much shear, too much friction, too much moisture all at one time before the body could develop that that callus, and then you get tissue tearing. Before the tissue tearing, there's a fluid buildup. That's the initial, basically extra fluid to provide more barrier and protection to the underneath layers of skin, because the top layers are dead and who cares about the top layers, but the bottom layers we want to protect. So think of it, the shoulder, you have a blister because of, for whatever reason, you've been up here and it's rubbing and it's causing an irritation to instead of the skin, to the tendon. The rotator cuff very likely is the area that's become sensitive and irritated. And if you tweak your instead of having these rubbing, if we just open up our shoulders, that's going to create some space. We don't have that same friction anymore. It's going to feel better. But that same person, if they're careful and cognizant of what's happening and modifying things and as they go, they can develop that callus to that same pressure over time, to where, I can't be, forwards. Of course, I can't raise my arms overhead in this position, so I have to be back here at some point. But I also will find I don't need to be at maximum retraction to be able to function. I can be somewhere in the middle, and I'm not getting enough pressure to cause a blister, and I'm going to tolerate that and get back to, a little more flexibility there versus when they're irritated, they have that blister. That sensitized area, we need to be really aware of modifying things so that they'll relieve that pressure and that irritation to that specific tissue.
So if I'm here, do I have more tolerance than here? So let's say I'm going to do, or is it only dependent on how much I've done these exercises? Or is it, in general, I can develop more tolerance and better leverages here than here?
So it's definitely the second position you're showing here, that more retracted position, that more neutral position in terms of the shoulder, the head of the humerus, the ball is not pushing on the front of the shoulder and creating compression and irritation to those anterior tissues, but it's sitting more in the middle, so it's equal pressure on both the front and the back of the shoulder. The ball is more seated in its socket, and it's a more stable position, so yes, over time, your potential is higher there. You're less likely to irritate things in that position. But people's shoulder blades are angled slightly different. People have different angle shapes to the ball for different people's shoulders angled differently. So what looks weird and too forward for you, that might actually be neutral for someone else who's actually, they can roll further forwards, and it just looks off, again, dysmorphia, but for their body type and their bone structure, it's actually seated in the middle like you want it to. It's just my middle looks like this, their middle looks like this. We're talking about this movement is what we don't want, this movement, because the ball sitting in the front is stretching tissues in the front and irritating. But their ball sits in the middle and they just have a anteriorly rotated humerus or posterior rotated, or also the shoulder blade also has changes like this too. Theirs might look different than yours, but you want that midline for that person, that neutral for that person.
Yeah.
In general, all of our tissues do their best in a neutral position, not an in-range position.
Yeah.
And that's really for in terms of structure, our muscles function best in the midline position, not the most lengthened or most shortened position.
Yeah.
And same thing with our joints. They tolerate, the stresses are most evenly distributed in those neutral positions versus a maximum of any one position.
And that's another, I think that goes back to what you were talking about earlier with options of if you're limited in your ranges of motion, then you're limited in your options, but then that also makes squatting hips to parallel or whatever your standard is going to be. If that's your end range, now you're working at an end range, where if you had more mobility, you could squat to hips to parallel, even though you could squat lower, but now you're more capable because you're in that mid-range.
Right. Yeah, for sure. That is a good way to look at it if you're trying to, for performance and trying to improve performance. Well, if I develop more flexibility than is required for the task, then I'm not asking my body to function at its end range maximum with maximum intensity, because that's really hard to do. That's like a gymnast who can do the splits. Well, part of it is flexibility, but part of it also having the strength in the adductors, in the thighs, in that in-range position, that your body's saying, if we put our legs in this position, our tendons are going to snap. Our muscles cannot do this, so don't let it happen. Well, if they get stronger, then they can have the strength to hold that position, and so they actually can get more flexible because they have the strength to approach those in-range positions, and their nervous system isn't freaking out and saying, no, we can't do that. We're going to die if we do that. Like, well, we're really strong, so let's go ahead and try to extend ourselves out, and we can tolerate it better. So kind of the same idea.
Strength through that full range.
Right. Developing. So it's a lot of people, okay, I'm going to work on the splits. I'm going to stretch the heck out of the splits. Well, you do have to do some stretching. You do have to turn down that neural drive and allow the muscles to relax in that position. But you need to have strength in that position too, so your body can support itself in that position, or you're not going to be able to maintain the splits comfortably, or you might injure yourself if you do get the flexibility. Then when you try to do it, your muscles too weak to hold yourself up in that position too. So that's a good way to look at it.
Awesome. Cool.
Okay, so we talked about the fire alarm and the thermostat. Okay, the third one, I've got two more pain analogies that I really like to share. So this one is the cup analogy. I don't know if everyone's heard the cup analogy, but it's a pretty common one. And this is basically saying that pain is multifactorial. It's not all biological. It's not all tissue damage. Okay, tissue damage, again, does not equal harm or pain. It's not a perfect correlation. So our cups are fairly evenly sized, but mine's a little bit smaller than yours. So perfect. So let's say we're filling my cup. My cup is my ability's capacity to tolerate stress, physical and mental stress, emotional stress. So, okay, my workout for the day, we pour some liquid in the cup. The amount of sleep I got, I didn't get much sleep, that's extra stress. Pour more stress into the cup. Your nutritional, your blood sugar and your calorie intake versus outtake. I'm under eating, more stress. I'm sick, more stress. Work is crazy right now, more stress. Whatever.
Bad food, inflammation, more
Bad
stress.
food, inflammation, more stress. And as the cup starts to fill up and overflow, if we have too much liquid that we're trying to put into our cup from different factors that are not all physical, but mental and emotional as well, when the cup starts to overflow, that can be a physical manifestation of pain. Again, that's where all our thermostats are freaking out and saying, our body is really stressed out and weak right now. Tighten it up, tighten it up, tighten it up. Don't let it too hot, too cold. Don't let it too much pressure or too much, too light
your
pressure.
buffer zone's gone.
You can't afford these buffers
Protection
because
mode.
You're super stressed out. We need to be really, really tight with everything. Okay, and so that is the cup analogy is, okay, it's overflowing and we're having these pain issues, these stressor issues. There's two strategies that you can take. You can try to not put so much fluid in the cup, right? Take away some of those stressors if you can. Identify the stressors that you can alleviate.
Yeah, and you can.
There are always stressors that you can alleviate. It's and if you say you can't, that's just priority. You're not prioritizing the liquid in the cup.
Exactly.
You got to find some that you are willing to let go of for the time being. And that's the quickest, easier thing to do, right? Is, okay, I'm not, for whatever reason, I'm super stressed right now. I'm really irritated. I'm super sensitive. Okay, reduce my physical activity. That's a fairly easy one to modify, especially our workouts. It's a choice, right? It's something we have to do. So that's one of the first things that you can do. But you can also get more sleep. Prioritize your nutrition better.
Yeah.
Okay, you need to take a day off from work. Take a mental health day from work.
Go for a walk.
Call home, call out, do all the things that we also use filling the cup as for people that are healthcare providers of, I'm using my fluid to help other people and give them more nourishment.
Yeah.
So, but fill your cup, drain your stress cup, right? Do what you can to bring this down by being with your loved ones, doing things you enjoy, eating and sleeping well, and help to kind of bring down the amount of stressors in your life.
And you can tell me that this doesn't work, but what I'm envisioning when you're saying this is the amount of stress is the water.
Yeah.
And the amount of sleep you get, high quality, good sleep, you have a bigger cup. And eat really, really well, the right amount for how you're working out. You have a bigger cup. And so you could end up, if all your lifestyle stuff, if you're meditating, if you're doing breathing exercises, if you're getting your 10,000 steps in and not living a sedentary life, if you're doing 10 minutes of yoga, mobility stuff every day, good quality movement, exercise would be the liquid, but in the long term, that's good for you. But anyway, so if you're doing all of these lifestyle things, you could have this big old cup that can then handle more workout liquid.
Yeah.
So I feel like a lot of people are going, more is better, more is better, more is better, more is better. But until you get a bigger cup, you can't handle more.
Right. So that's a good way to look at it. If you're getting technical about it, sleep is a restorative thing to bring down those stressors. So you could think of sleep as puncturing a hole in the cup that's draining some of the fluid out. As you fill it, you're draining some of it out at the same time.
That's cool.
Would be a way to look at it, that you build up these release valves, basically. But that's the second part, is the longer term strategy. And that's why your analogy doesn't fit with my analogy that well.
Sorry,
because you can change those things fairly quickly if you really set your mind to it.
Yeah.
But developing the bigger cup, that's the longer term strategy of building up your tolerance and capacity for stress. And we use the lens of physical stress, right? So if we work out in a structured way, we increase our body's capacity to tolerate physical stress. But you could also practice this with meditation, with mindfulness practices of trying to manage. That's more controlling and managing the amount of stress, but gradually exposing yourself to more and more stress over time, your body will adapt to be able to tolerate more stress at once. So that's where, if you can take on, instead of taking on 10 new projects at once, that's all of a sudden going to overflow your cup. Take on one new project at a time over a series of weeks or months, or time. It's hard to say, but gradually increase your workload, and your body will adapt a bigger cup over time to tolerate that, versus dumping all of a sudden a whole much more fluid in. That's the beauty of our bodies. They're not cups. They're living, breathing organisms that are ecosystems that adapt to the stresses that we put on it consistently. So if you consistently put, I don't know how much, I think this is 32 ounces of fluid into this cup, my cup is going to grow big enough to tolerate 32 ounces of liquid. But if you take your cup that can take more liquid and we only put 32 ounces in it, it's going to adapt and say, well, we don't need this big of a cup. We only need a 32-ounce cup. Let it shrink down a little bit. And it adjusts over time to the stresses and the stimulus that we put onto it, and which is awesome. Really cool stuff that our body can do that for us.
Yeah.
But it plays both ways. If you neglect the cup, don't use the cup, and it also will fluctuate, and you can lose some of that fluid. And sometimes it's just that's unavoidable. It's constantly changing, so you don't want to add more stress to yourself by really thinking about, am I expanding my cup, or is my cup shrinking all the time?
Yeah.
But you might recognize all of a sudden, I thought I had that big of a cup. All of a sudden I have this big of a cup, and it's overflowing all the time.
Yeah.
Let me go back to some of my strategies to either acutely remove some fluid for now, and then work on myself so that I can develop that cup again.
Yeah. Or maybe you do, and you're filling it up with too much outside the gym stress. I'm assuming people watching this are probably gym focused.
Sure. Yeah.
Then it's like, you've lost some gym capacity because what's going on in your life.
Right. And so sometimes this goes back to you have pain with the workout. It might not be the workout's problem. The workout pain is the symptom. It's not the cause. In a lot of situations, it's like, okay, well, you're working out at the same intensity, but you're sleeping half as well.
Yeah.
Your work stress jumped up because you're a teacher, and over the summer, you weren't working, you're feeling pretty good, you got in a really great workout scheme over the summer, and you tried to maintain that same workout while adding in the big stressor of work coming back.
Yeah.
Where probably you need to drop down a little bit when you introduce new work stresses and build that workout intensity up a little bit over time again. So yes, that's a lot of times, that's what we try to do in physical therapy, or that's what I try to do, is again, not blame the physical activity as the culprit for everything, because it's not always, and we know that physical activity is super important, super valuable, provides the reward is way bigger than the risk when it comes to physical activity.
Yeah.
And so a lot of people, unfortunately in medicine, their first thought is, well, don't do that. Don't do that exercise. Stop doing the exercises that bother you. When really it's like, well, keep
I've heard
exercising.
that a lot from doctors.
Yeah,
that hurts, don't do it. And it's like,
that's my dad's favorite, and my dad's a good doctor. He's a very conservative doctor. He's not one to pump you with drugs and stuff. But that's kind of his old saying. I come up to him and say, Dad, my wrist hurts when I do this. And he'd say, don't do that.
Yeah.
But then when it starts to feel better, he'd encourage you to get back to doing the thing that you want to do. But yeah, I mean, sometimes maybe tweaking your workout because you're not tolerating it well. Not because it's the problem, but because it's not being tolerated. So don't do something that's not being tolerated.
Yeah, if you've got this much stress in your life and you're not doing anything about it, then you can tolerate this much exercise. Right. But if you're used to this much, it's like, bring it down a little bit for now.
Yeah.
Even everything out.
Exactly.
And then bring it back up.
But there's other fluids that you could take out as well.
Yeah.
That's where, okay, well, what's going on with your sleep? What's going on at home? What's going on at work? What are these issues? And let's really address those, and then you'll be able to get back to doing the workouts that you were doing, not, oh, that was a stupid idea to work out at that intensity or that volume.
Yeah.
Never do that again, because that'll always cause you problems. It's like, well, no, if you take care of these other issues on the back end and develop that bigger cup, work out as much as you want.
Yeah.
And work out as much as you tolerate. And base it off of that, not based off this conception of, well, working out is stressful, and so I shouldn't work out as much. So working out is one of those good stresses that we have the luxury of doing in our culture, our community. We don't have, and we have the luxury of dialing it back and dialing it up based on how we feel. Unlike someone who's in manual labor all day, and the manual labor is the manual labor that they're doing, and they have to do that every day to pay their bills. That fluid is not going away. They can't change that fluid. Unfortunately, well, sometimes they have no choice, but if it was up to them, or their bottom line, they can't afford to change that fluid. Their workout might be very small. Their capacity to work out might be relatively low. They might really have to focus on sleep and nutrition, because those are the only areas that they can really adjust. Or some of us, we have the luxury of, okay, the workout is the most stressful thing that I do, which, in my opinion, if your workout is the most stressful thing you do, that's a great place to be. It's a great place to be. It's a good goal to get to, because if your voluntary workout is your hardest thing you do, then everything else is easy and well tolerated.
I would say, if that's the case, that's awesome. Enjoy it for a day, and go find something out in the real world that makes you uncomfortable. You're stagnant in your life. Get out there. Go get uncomfortable.
So I had one more analogy for understanding a little bit of pain science for you guys, and so the last one I like to use is the example of the prison and the prison guard. Okay, so and this is really relating to how pain is really a form of sensitivity, and your body's tolerance to stressors can manifest in pain versus what's actually causing a problem. So if you're at a prison, and I've never been to prison, I don't have that great experience, but I've watched a lot of movies, watched TV, and I've learned about prison, and you have prison guards that are watching over all of the incarcerated inmates, and they have rules and they have orders that they're following, and they have standards and procedures to make sure that nothing negative happens. Nobody gets injured, no one escapes. I'm sure there's other reasons, but they have reasons for all of these things. Mm-hmm. And if everyone's playing along, everyone's following the rules and staying in line, and no incidents have occurred, then those prison guards might become a little more friendly and a little more relaxed with their rules and regulations. They might allow a little bit of slippage on some of the rules that they might consider minor offenses that don't really negatively infect anybody. They might let you, stay out in the yard a little extra time because, well, he's a good guy and he's fine and he's just getting his workout in. We'll give him a couple extra minutes. Mm-hmm. Or they might let you get a little more food at the mess hall because, again, they're just being friendly and they're being a little loose, a little bit more relaxed, and everything's going well. But if an incident occurs, if someone attacks another inmate, or someone escapes the prison, or something negative happens, something bad happens, then the prison guards might be likely to tighten down their rule and be a little more restrictive and a little more conscious of what's going on in the prison, and be a little more aware and questioning every prisoner's action. And okay, why are you here? Why are you late? You're not in the right place. You're not following the rules. And being a little more strict with their rules and a little more intolerant to breaking of the rules when there's been a big infraction recently. Mm-hmm. And so this can be the same way that our nervous system reacts to an injury, and not even just an injury, but an onset of pain. That, okay, we've had a painful incident, whether it was true tissue damage or an inflammatory response or it was a response to stress, but my shoulder had pain, it was injured. Let's say it was an injury, that's the easy one. It was injured. Now weeks have passed since the injury, and the injury itself might have been taken care of. It might have resolved and healed, because in many cases our tissue does heal on a fairly consistent manner if we, depending on our age and our nutrition and our health, our sleep and our overall health, our tissue will heal and recover to some extent, to the extent that it needs to, in a matter of days or weeks or months, depending on the tissue. But most of the time it's weeks. Well, even if the tissue is responded and is healed, the nervous system might still have a protective response.
Keeping a close eye on it.
Exactly. It's going to keep a closer eye on that area. It's going to be more watchful, more sensitive to changes in fluctuations in stress and strain in that area, in an effort to not allow it get to the point of an injury again. Mm-hmm. And so this shoulder might have been recently injured. This one I have not injured. This one is now healed from the injury, or even mostly healed, but mostly healed to the point where it's just as structurally sound as my other shoulder is, but it can still be more likely to give me pain in the same situation. So I put the same amount of weight on both shoulders when I'm using a bar, but because this one had been injured previously, and it doesn't even have to be necessarily extremely recent, it can be a remote injury if you don't resolve these things, but it can be more sensitive to that stress and quicker to turn on the pain response than the other shoulder because of that pain or because of that injury, that history. And so that's something that we want to be keeping in mind when we're recovering from an injury is, okay, how much time has passed? How much of what I'm dealing with in terms of pain is due to the structural integrity of my shoulder or my back or my tendon or whatever tissue was injured, versus it is sensitive to stressors right now, and that is what we need to be aware of.
Yeah. And so something I've heard a lot is soft tissue work with like foam rollers, lacrosse balls, just massage, those types of things. It's for tissue health, rehydrating the area, a number of things. But one of them is desensitizing the area to pain.
Yep.
So would that be something you'd recommend to somebody who is kind of coming back from an injury, doing something that's like, look, I'm doing everything right. I'm working with Jared, he's telling me the pain's good, and then, you know, slapping a lacrosse ball on it and getting some movement in there, that kind of falls in line with
definitely
the thermostats.
Definitely. So that's, honestly, for me, I mean, a lot of people will find, these different foam rolling, lacrosse ball, soft tissue, manual therapy, increase blood flow to the area. And so there's a potential that increased blood flow means increased nutrients, increased healing capacity. There's not a lot of support in the literature that actually happens.
Yeah.
It's more anecdotal evidence, which, again, we can get into the nuances of, well, it works for you, it doesn't work for you. But for me, the biggest benefit for those things, and again, it's highly personable, is the stimulus for you might help desensitize you, but for me, it might irritate me.
Yeah.
If I don't like needles, I'm not going to get desensitized from needles, but you might love it for whatever reason.
Yeah.
But basically, it's providing a novel stimulus to the system, something different than the pain stimulus that it's receiving, and that resets the system or desensitizes that system. So a great example is the lacrosse ball, the foam roll. Okay, so my shoulder's not a great example for that because you wouldn't really, it's uncomfortable to do. But let's say the tissue on my forearm is sensitive to pressure and stress and strain. Well, applying more stress and strain with a lacrosse ball or a foam roller that we recognize is safe, you could potentially bruise yourself, but you're not going to tear apart your muscle with a roll of some sort. But that stimulus gives the body a novel stimulus, something different, and it says, that was a pretty high stimulus, and our body survived. So this stimulus down here that wasn't so intense, that didn't injure us either, if we can handle more pressure, then the lower amount of pressure is safe. And that's where you can feel better and your sensitivity to that stress goes down.
So is that good, or is that just tricking our body to stop feeling pain? Because I've always looked at it as good, but I just had that thought of just like, where are we just hiding the pain?
I don't. To me personally, it's not that effective that you're totally numbing yourself to pain so that you can push through a wall. You know, it's not that effective. It's to temper it down, to bring it down. I think of it as a good thing pretty much always. The issues of like pushing through pain and ignoring pain and pushing to the point where you're causing an injury. Usually you're going to get to a point where those novel stimuli are no longer giving you that result, or that's a short-term result anyways. Most of that stuff is only going to help for an hour or 2 hours, maybe a day if you're lucky. But that's my experience, is none of that stuff is going to give you a long-term benefit. It's to give you feel better now so you can move more now. Moving more is the thing that actually helps you better. So if doing a lacrosse ball or a foam roll or a heat pack or an ice pack or a massage or acupuncture or any of these types of things that are just different stimulus makes you feel better and have confidence, because there's a placebo mental effect to it too. If you believe that it makes you better, whatever, that's fine. Makes you feel better to the point where you're going to go ahead and get a good workout, get some physical activity in. Again, that's the thing that we know has the most evidence that it's beneficial. And so now, am I going to say, everyone needs to do a foam roll, everyone needs to do a lacrosse ball? Well, no. Not everyone's going to get the same response. And so it's like, do you like the foam roller? No, I hate the foam roller. Then throw the foam roller away. Don't worry about it, But I like the lacrosse ball. Great, go with the lacrosse ball. But that's not the thing. I always make sure people understand, that's not the thing that fixes the problem. That makes you feel better so that you can use your body to fix the problem. And that's the key thing is, if you're just doing the foam roller, it feels better, and then go about your business, well, you're just going to keep using the lacrosse ball, use the foam roller.
I think that's
not going to actually fix anything.
Major point. I love that, because that's what we see over and over again. This thing's going on, but I lacrosse balled it. And it's like, well, what'd you do after? Did you use the thing? And a lot of people are just using it as like, if I work this area, my overhead squat's going to get better. And it's like, did you overhead squat?
Right.
And it's like, no. It's like, what?
You got to do overhead squats to get better at overhead squats.
Exactly. Use it as a tool that facilitates quality movement. I like that a lot.
For sure. Well, the idea that you're deforming tissue and manipulating tissue is kind of far-fetched to me. It's like, if I give you a steak and say, okay, hey, tear the steak in half with your bare hands.
Yeah.
You're not going to be able to tear a steak apart with your bare hands unless you're really super strong. And that is a dead cow that's been dead for, a long time. Your healthy, fresh tissue that's in your body, you're not even being able to grab it and pull on it. You're trying to roll on it with something and you think it's actually going to change the structural integrity of that thing. If it does, that was a really weak muscle that was going to tear and get injured in some way anyway.
Yeah.
But that concept and idea that what you're doing on the surface is actually improving or changing the structure of your system, not really what I buy into.
Yeah.
It's much more of that nervous system desensitization, make it feel better, make it less sensitive, so I feel more comfortable to move in the ways that are healthy and are productive.
And is there any merit to when you're doing that, it helps reduce how your nervous system is responding to it, which then lets your body relax more and treat it more like it's mid-range instead of end-range. Yeah. And so like what you feel is the tightness kind of goes away, but you're not like gaining length. You're just gaining your brain's letting you use it a little bit more.
Exactly. So one of those thermostats that we're looking at, there's actually two, but is your body is monitoring muscle length and tendon tension. Okay, and so for instance, if I extend my arm, my bicep is getting longer, my brain, my nervous system has a register for how long my bicep should go safely. And it might kick on, so I can't fully extend my elbow. And my bicep's a little sore today for some reason. From whatever workout.
Pumping up
all
too
the
much.
workouts that I've been doing. But it's not because my muscle is too short. It's because my nervous system kicks in and says, that's long enough. Don't relax any further into that stretch.
Yeah.
If you turn down that nervous system drive, which you can do through rolling and through manipulation of the tissue, massaging, that feels comfortable, that feels good, that feels good. Widen that thermostat, it's going to allow you to lengthen that muscle further, and you'll be more flexible. It's not because your muscle is longer, it's because your nerves dialed down, so it's allowed lower tone in that muscle. And so that's really what you're looking at with a lot of that stuff. That's a problem that with stretching, people say, stretching, got to make it longer, I got to pull it, force it to go longer. No, you need to go to where your body's saying stop and practice trying to relax.
Yeah, breathing through it.
Breathe, relax, try to turn that nervous system down, and so it's going further over time because that's okay, that's not hurting. We can go a little further. That's safe. It didn't tear apart to do that. Let's let it go a little further. And if you crank on it, your nervous system's going to get irritated and say, see, it made us sore. It was bad. We shouldn't go that far.
Yeah.
Tighten up even more.
And we've all seen that person doing the hamstring stretch and just going after it hard.
And amazing, those people never end up more flexible.
They're still doing that same hamstring stretch today. Yeah.
For sure.
And it is, it's the in range and relaxing.
Yes, it's relaxing.
And also the foam roller and relaxing. You can't get on a foam roller and tense up and yell and all these things. It's like, that's missing the point.
Right. If you're cramming on it and it's, again, some discomfort there is fine because that is going to help desensitize the system. But if it hurts and it's tortureful for you and it's not enjoyable at all, your body's not going to register that and say, that was a good thing. We're healthier now. We're better now. Relax more. It's going to say, what the heck did you just do? Yeah. Tighten up. Some sort of injury just happened. We just got ran over by a car. Don't let that happen again.
Yeah.
So there is that, exactly that. You're doing it with an intent. And the intent is to provide a stimulus. So you want to feel something, but you don't actually want to cause tissue damage, so you don't need to push as hard as you can and do it for a long period of time to where you're actually creating, sore, irritated tissues.
Yeah. That's awesome. Yeah, because that's kind of what I've heard for a long time is we're not lengthening it. So it's kind of all the reasons why people think it works are kind of probably off. But what I found, bro science, is it does, and maybe it is placebo, but it's like it does something for me.
Yeah.
So it's like it's a very recurring thing in what I do on a day-to-day basis.
Yeah.
And especially when something's feeling painful in a certain way, it's like, I'm really going to go to those areas.
For sure. So for me, I own a couple foam rollers. I almost never roll on them, right? I use them for bolsters, I use them for positioning, I use them for For mobility, I'll kind of hold them and do some mobility stuff with them. Mm-hmm. I very rarely actually roll on them, but when I do, it's on an area that's already tight and I can tell is irritated and sore, and say, oh, let me give it a little bit of stimulus, and basically because that's an easy stimulus to give it, and then it'll help me kind of relax, and I feel better afterwards.
Yeah. But
it's not something that I personally feel the need to do every day. If I'm feeling good and feeling well and my mobility has been good and I'm not feeling limited, I'm not gonna have that, oh, but I didn't foam roll today, so there's a problem there, I need to foam roll.
Yeah.
But if I'm feeling irritated, I'm feeling sensitive, and my back is tight and sore because of the workout yesterday, I'm gonna foam roll and make it feel better for today, for right now, understanding it's not gonna change the healing process, it's not gonna make me recover quicker. In the sense that the rolling did that. The rolling is going to make me feel a little bit looser, feel a little bit better, so I can move a little bit more and not protect my back as much. And now it's feeling better and it's recovering a little bit quicker because I'm using it appropriately.
Yeah. And and I like what you said too, because I think I said it wrong. I said I foam roll lacrosse ball every single day. It's like I don't. I move. And every morning is like one of the first things I do is like 10 minutes of movement, hitting in-range positions. And then if anything feels funky, get the lacrosse ball, get the something out, spend some time on it, move some more, go about my day. But most days it is just the moving around.
For sure. Mm-hmm. And that's kind of a meta thing that I have is everyone ideally takes their body through the full available ranges of motion on a daily basis as a check-in to kind of see, have I lost some, and not even have I lost mobility, because again, that's a very fluid thing.
Yeah.
Not having mobility this minute, 5 minutes from now, I can greatly increase that mobility if I want to. Or if I put myself in a more comfortable situation, I can improve that. But does anything feel off? Anything feel different than it felt yesterday or the day before? And then kind of seeing, okay, wrists feel good, shoulders feel good, oh, my hip is feeling a little restricted. I'm going to spend 2 or 3, 5 minutes working on some hip mobility and some stuff to kind of give some care to my hip. And it's just moving my hip, really.
Yeah.
And then working those kinks out a little bit before I go on in my day. And sometimes I don't have time to do that, of course. That's not always I can do that. But if I have the time at some point during the day, I like to make that same type of practice that you do. And only then, after I've done my movement, and if I've tried to organically move my body through some of these issues and it's not resolving, bust out those modalities. Where's my home electrical stimulation unit that I like electrical stimulation.
Yeah.
So I got one of those. Where's my foam roller, And I'll bust out those types of modalities after I've tried organically moving that area on my own, just because I prefer to just move it a little bit.
Yeah. Talk a little bit about the electrical stimulation, because I know that's kind of, it's not the new thing going around, but it's like I'm hearing more and more about it. Mm-hmm. So I've heard a lot of different contexts of why it's used, but I think when most people hear it, they think of the infomercial of you put it on your abs, and then you just sit there and then now you're going to get abs.
Yeah.
So maybe you can help us figure out when it's appropriate to use, why we would use it, and what it's good for.
Yeah. So there's a lot of different.
And I guess we should explain what it is in case it's those pads that flex your muscles, and if you put it at the right spot, you can hit yourself in the face.
Exactly. So I have a portable unit actually that I used it this morning with the client this morning, but it's essentially it's an electrical device that's attached to 2 electrodes that you stick on your skin, and it can be 2 or it can be 4. It can be in different settings, but it sends an electrical signal through those pads that can create a couple different issues. Basically recreates what the nervous system does when a nerve sends a message up and down, and it causes a contraction of a muscle. Mm-hmm. So it can be used, there's several different settings and several different techniques, but the main 2 are what's called TENS, which is transcutaneous electrical neuromuscular stimulation, and that's really more of a pain relief setting and parameter, and that's based on the wavelength of the electrical current that's running through it, the amplitude and the frequency of the current. But that's more of a very light pulsing, and more of a sensation, more of a pins and needles kind of a tingling type of a sensation and a little bit of contraction. That's mostly for pain relief. And again, it's just like all these other stimulus. It's a novel stimulus one of the theories is your body can only interpret one stimulus at a time. So instead of the pain stimulus, it just feels the electrical stimulation stimulus, and it feels better. Doesn't last very long. It lasts while you're doing it. Again, maybe an hour or two, a couple hours that day. Doesn't particularly heal things better, but if it makes you feel better, calms down your nervous system, and gets you more comfortable to move a little bit better, good. I don't do too much of that. I do that again because I'm not a big modality person. I'd much rather just teach you it's okay for it to hurt a little bit, and let's move anyways. But if you're just absolutely can't move, hurts too much, super spasmy and tight and restricted, okay, well, we can put some electrical stimulation on this. Or right after an acute injury, we can do some electrical stimulation, and it's going to allow it to feel better so that you can move more. And that's always the end product for me, is to how can we move in a way that's going to help.
And sorry to interrupt, but I keep going back to it just because I don't want it to be misunderstood on the other side. Is get you to move more, but that doesn't mean at maximal, and you said it 1,000 times.
Low intensity.
I'm just really trying to emphasize for them, because I don't want anyone to misunderstand and be like, oh, it's okay for me to go do my workout. And it's like, kind of like you can go move, but you need to back off of everything to the levels that we talked about before. So I just wanted to keep reinforcing
gentle, controlled motion, a workout at 50%, 25 to 50% capacity, something like that. That's TENS. The other form is, and again, there's more than these two, but the other main form is NMES, neuromuscular electrical stimulation. That is the one that creates the muscle contraction. That's where, when you do it, I did it on my client's quad today because she has some quad weakness and some quad inhibition.
Kick a football through the uprights.
You can, but the one I bought is one of the most powerful ones that you can get. My muscle will go to full tetany, contracting harder than I can contract it on my own. It hurts.
It's crazy.
Do it for 30 minutes, and it's set like a strengthening program, and my muscle gets DOMS and soreness like I had a good workout. Because again, the muscle's doing the same thing that it would do if I'm, contracting it up through my brain. You can argue whether it's not the same. It's not as effective as just using the muscle and incorporating it into a movement.
And incorporate it into using the rest of your body with
it. And so the timing of using it. But in some situations, if you can't contract the muscle, if that connection isn't there right now because you've had an acute injury of some sort or something like that, then it's a great way to recruit that muscle to go. And so, the unit that I have is called the Power Dot. It's pretty popular nowadays. It's a small portable thing, but they
do have. There's like $20 units, and there's like $10,000 units.
So this one is a several $100 unit that I have.
Is there any? If someone's looking and they find a $50, or those don't bother with those, or those are good enough?
It depends on what you're looking for. The TENS units, the ones that are just feel-good pain relief ones, you can get those on Amazon for under $100.
But we don't like those.
You could do foam rolling and do other stuff.
The ones that are like
maximum muscle contraction. You can get them on Amazon for. You can get them online for $100 to $200 and get one that's pretty solid. When I'm looking at those kind of things is, if someone's looking to buy one, is look at the reviews and see if people have a lot of positive reviews in terms of the strength. You want one that's strong, okay? You want it to be able to give a good contraction. Excuse me. I prefer to get one that is rechargeable versus one that uses batteries, just because they tend to do a little bit better, and they tend to be a little bit stronger as well. And ones that have a digital interface versus there's ones that have a dial that you turn the analog dial, which again, there are ones that work just fine with the analog dial, but typically the digital ones are a higher quality. And so I don't have a specific brand that's affordable to recommend.
But probably stay away from the $20 ones.
Don't
you
get what you pay for with those things,
But you don't need $1,000.
You don't need the $1,000. The clinic I used to work at, they have the $1,000 ones to give to people, to sell to people. And I would use it in the clinic, and if they had a good insurance that would pay for it, because sometimes they did, take this one. But if they don't and they're paying out of pocket for it, go on Amazon and get one for $100. And look at the reviews, see if people are saying this is strong and helpful, or it's kind of look for it's weak. It's kind of not very strong. If there's complaints, then that's a red flag. I would also really try to find one that has a return policy so that you can test it out, you can try it, and send it back. If there's no refunds, because you don't know if it's going to work for you.
Yeah.
Even if it is strong and powerful, you might not end up liking it if you've never tried it before. So I like to see, do they have a return policy that I can try it for a trial period, or and then see if I like it, see if it's what I'm looking for, see if the battery life is worth it for me, and if I even like doing it. And then if not, send it back.
Yeah, and I've got one, and I like it, but because you got to move the pads around, because another use for it would be just getting some easy muscle contractions to help aid your lymphatic system and blood flow for recovery.
Right.
And so that's what I got excited about. Then I was like, well, the practicality of it is I'm going to move these things across my whole body. It's just like, it's not practical.
Yeah.
So the injury or the pain side of things, I think, is more practical, and that hopefully is coming in less and less. But if somebody is on the other end thinking, I'm going to use this for recovery for these reasons, for me, moving those little pads around, it was just like I did it one time, and it was a lot of fun doing it one time, but there wasn't a lot of, like, I'm going to need to get that thing back out. I'm going to need a very specific recommendation from you to be like, oh, dude, this is the time that you use it. And be like, oh, I'm glad I got it.
I mean, use it for a specific area, a specific body part. You have an area that always gives you trouble, that kind of thing. But if you're looking for total body electrical stimulation to give recovery, just move. Just move your body at a low intensity.
There you go.
And that's going to give you a better effect.
Yeah.
Because that's going to get the muscle contraction you're looking for, but also joint mobility. Joint motion is how our joints get their nutrition.
Yeah.
And so if you're just sitting there and you're just doing the muscle is going to help, and it's going to help with some lymphatics, it's going to help with some circulatory issues, but there's other areas that aren't going to get addressed.
Yeah, that's
your tendons don't get it. Tendons really respond to heavy loading, and so the muscles just use and contraction and blood flow.
Yeah.
But a tendon actually needs to be loaded with some sort of stress and strain, and time under tension is a measure that we use for that. Is the amount of load that you're doing over time stimulates tendon regeneration and tendon health.
Yeah.
So muscle stimulator is not going to help your tendon health very much at all. It might make it, again, you can make it feel better for a little while, just with that sensitivity issue, but in terms of actually healing your tendon and making it a healthier, stronger tendon, it's not going to help with that.
So that's a good perspective, because the muscle stimulator might help with muscle soreness and recovery of the muscle, but movement could do that same thing and also help
joints
the joints
and tendons and bones. All these other tissues are going to respond to movement. Even our nerves respond to basically the nerve sits in a tunnel, and moving that nerve in and out of the tunnel, through that tunnel a little bit, helps. That's a lot of our lymphatic system actually runs right along the nerve in that tube, and so getting that movement is going to create that lymphatic motion that you're looking for.
Cool.
Okay, so I wanted to go ahead and do a drawing for you, and this is going to tie a lot of the things that you've been prompting me about and asking me about, and some of the questions that you've had. I think we'll tie along with some of these illustrations that I'm going to try to do, and kind of help people understand how all of this pain science and sensitivity and movement dysfunction versus dysmorphia and stuff all kind of comes together, and how we work on that when I'm working with someone. Okay, so I'm going to try to draw two different illustrations for you here, but the first one, it's pretty simple. It's just a graph, basically. Okay, so on this here, can we see that okay? Cool. So on here, this bottom line here, this is a volume, and so this side is load. Okay, so think of it as we're prescribing an exercise intensity. You can either have a high volume exercise, a high load intensity exercise, and of course a combination of the two. So something that's high volume, low load might be walking a really long distance. High load, low volume, 1 rep max lift, right? Okay, so this is a way that we can kind of measure the intensity of our physical activities. All right, and so there's a couple things that you want to be aware of when you're looking at this. First off, we're going to draw a line with the blue marker And this blue line, and this is abstract, everyone's lines will be different for an individual and for specific body part, specific day, specific activity. There's lots of, you could draw 100 graphs here. But in general, you have this line here, something like this. And this line we're going to call our capacity. Well, that's not going to be big enough. And I don't write very well. Capacity, the solid blue line capacity. If you cross this threshold, tissue damage can happen. This is what actually will injure tissue. And again, the tissue capacity of a bone might be higher than the tissue capacity of a tendon. My right shoulder's capacity might be higher than my left shoulder's capacity. So this number, this can change, but this doesn't change over time all that quickly, okay? Your bones can take what the bones can take, although you can improve it over time. The second line I'm gonna do in blue is the dashed line, and I'm gonna give it some space just so we can read it a little bit, but this dashed line is going to be our tolerance, okay? So going back to our prison guard, our tolerance, our sensitivity to that stress, okay? So I'm going to draw that out here. This is tolerance. So you do more than what the dotted line, that's where you get pain and soreness, okay? And again, in most healthy individuals, the tolerance line is going to be lower than the capacity line. Okay, there's a protective mechanism built in there. There's that buffer. It's going to bother me, but it's not going to break me until I cross the blue line. Okay, if you've just been injured, if you have a broken bone, capacity is lower than tolerance. I can make myself do something that my bone physically can't handle. So that's the case where this can get flipped.
Okay,
and that's what my second graph will show a little bit. But tissue tolerance, tissue capacity. The black line is what you actually do, right? Okay, so you could graph on this, but this is where you have what I'm actually doing on a given day, okay, is my activity, okay? And so those are the main lines that you want to be aware of, and this is something that is called the envelope of function, okay? Someone like myself, I know for me, I am much better at the higher load, lower volume stuff. I'm a sprinter, I'm a jumper, I'm a 1-2, less than 5 rep lift kind of guy. I tolerate that stuff, feel better doing that stuff, perform better doing that stuff. So my blue line might be higher on this side and a little lower on this side, okay? And probably because my black line is also, I just like that stuff. Someone who's a marathon runner, this top might be a little lower, but their volume tolerance is higher, and so their graph is a little bit flatter, a little bit wider. So this, of course, changes from person to person. Okay, so those are things that ideally you have some idea of this. Now, capacity, like I said, is fairly stable. You don't want to learn what your capacity actually is, but that's what you're doing when you're doing your 1 rep max, is really testing, getting close to that capacity and not injuring yourself, but how high can I lift, how heavy can I lift, and my body can take it. And it will go up over time. And this is where doing 1 rep maxes sometimes is valuable information, so that okay, I have to pick up this bag of rocks on the ground, how heavy is it? It's 100 pounds, I can lift 100 pounds 50 times. Not a problem for me, I'm gonna pick it up without any worry. Oh, that's 500 pounds? Help me, Kyle, I can't pick this up. But if someone doesn't ever lift heavy things, they have no concept of what their capacity is. And so they're more apt to injure themselves, potentially, if they overshoot the line because they have no idea where that line is. But they also might way undershoot in terms of limiting themselves and saying, how heavy is that? 50 pounds? I can't do that. But we actually know very likely they can do that.
And we see that a lot with beginners, is just like they don't have the confidence, and as soon as it's hard in the slightest, they're like, no, that one was hard. But they don't realize that, they're down there.
If it's hard, you're probably in here, right? You're probably, you're probably getting close to where that you're above that tolerance line where your body's saying no. But it's not breaking, it's responding fine, and it's recovering fine, and so you can continue to do that. And the tolerance will go up fairly quickly. And then your capacity will go up a little bit slower. But if you keep working at it and you're persistent with it, then you can push both of these numbers higher.
Yeah.
All right. Make it a little more complicated, but essentially what the goal is of knowing these two lines is to adjust the activity, because the tolerance and capacity lines can change over, and specifically the tolerance can change, as we've talked about, on a minute-to-minute, day-to-day, week-to-week basis. This can fluctuate. And so it's learning to recognize my tolerance and adjusting your activity to your tolerance.
Yeah.
And understanding there is a little leeway there where you can push past it on good days. Mm-hmm. Days where you've been sleeping well, eating well, feeling really good. I'm going to push to capacity because I've been tolerating things really well.
Yeah.
And I know that my tolerance is probably pretty close to my capacity right now.
Yeah.
If you've been sleeping poorly, eating poorly, you've been on vacation, well, not vacation, but a stressful vacation that didn't go well, and you get back and you haven't been working out for a while, then you should know that both your capacity, definitely your tolerance, is going to go down for the week or 2 or 3 weeks after that. And you should work out at a lower intensity and build that back up versus just overshooting that line, and you're going to create that soreness and pain and cause some issues.
And sorry if I'm jumping ahead to your second graph, I don't know what it is, but the other thing is if you do a 1 rep max deadlift, and that's your graph, what we know is the next day, all of these lines shoot way down for a 1 rep max deadlift.
Yeah.
And then they'll slowly go back up,
Correct.
and then maybe a week, 2 weeks later, they're going to be above where they were before, but it's going to take a little bit before you get back there.
Right.
And so I feel like a lot of people feel like they need to lift at tolerance and capacity. They need to be hitting those ranges to boost them. Mm-hmm. But the reality is you can give yourself, it's got to be a big enough stimulus, but you can give yourself a much bigger buffer zone than what people tend to think.
For sure. And that's I'll take the activity line away, because I have 2 more lines that are theoretical lines that are good to know about. And again, these are all abstract things that you can't really know for sure, but it's a philosophy. So we have the idea of, so the capacity line. Capacity can also be known as the maximum tolerated dose. Well, I guess that's the tolerance line, huh? It's confusing to use them as different terms. But maximum tolerated dose, which basically means if I do just under this line, my body will tolerate it. If I go over this line, my body will break down, okay? So that's the maximum tolerated dosage, and this is something that comes from pharmacy, is what's the strongest amount of this drug that I can give someone and they're going to tolerate it without getting sick, because drugs are all basically chemicals, and they're called poisons if you ingest too much of them, and they're called medicines if you ingest an amount that has a positive therapeutic effect. But that's where that comes from. But it applies to exercise too. There's a maximal tolerated dose. That's the amount that you can work out at and you can recover from it.
Yeah.
Okay. And then there is, I'm going to use the black one. For this one, there's a line that's down here, and this one we're going to say is the minimal effective dose.
Awesome. Yeah, and in terms we use in programming is minimal effective volume and maximal effective volume.
Okay.
Or sorry, minimal effective volume, maximal recoverable volume.
Gotcha. Yeah. So same idea.
Yeah.
And so really that's a function of load times volume, right? The amount that you're doing and the load that you're applying is going to help you figure that out. But the minimal effective dose, that's anything better that is more intense than the minimal effective dose is going to provide that positive effect in terms of raising your capacity, okay? Improving your strength. So that's different, depends on what your goal is. But the minimum effective dosage is the intensity at which you need to perform your activity to create this, to get that stimulus that you're looking for that's going to stimulate your body to create the positive tissue adaptation that you want. What we have found, because most people don't, these are imaginary lines, you do not know these lines.
Yeah.
So the easy easy, simple way to do things is get as close to this line as you can because get just underneath that maximum dose because then you know you're getting a good dosage. Mm-hmm. But we have found, when we say we, I mean the collective scientific research community, not I have not found, but I have found this anecdotally, the minimal effective dose for a lot of people is quite a bit lower than the maximum tolerated dose. Now, as you get to high-level athletes that are at their peak of their genetic potential, who truly are pushing their bodies to the max, their minimal effective dose and their maximum tolerated dose are rail thin. And the gap, the room for error for them is pretty small between not getting enough workout to actually get better and getting enough that they actually have tissue breakdown. Mm-hmm. And that's where it gets pretty complicated. But for most of us, and this is maybe too big of a gap, but just so you can see it, there's a big window here.
Yeah.
And so when you're trying to prescribe your exercise, you want to be above the minimal effective dosage line, below the maximal tolerated dosage line. Mm-hmm. Okay, that's what you're looking for.
And something we see a lot is, and this goes back to the more is better.
Yeah.
And people are just, gotta go hard, gotta go hard, gotta go hard. And it goes back to the same thing, and it could be deadlifting, it could be everything, but when you go hard, the next day this gets brought down.
Yeah.
And so when you're trying to go hard all the time, what it ultimately does is it brings the max you can tolerate down.
Right.
Where if you mix and match, making sure you're above minimal effective volume, unless we are trying to recover a specific body part.
Yeah.
But bringing it down closer to that minimal level on some days, so we can keep that maximal level at even higher up.
Yeah.
Is kind of the balancing act in programming.
Yes.
You can't bang your head against the wall because you're actually going to decrease what you can tolerate. Whereas if we have some medium days, some easy days, some hard days, what we can actually do is make those hard days harder. You're going to get more benefit out of those.
Definitely.
Because I think it would be like an exponential results. The more time you spend up in these areas, mm-hmm. way better than minimal effective dose, where this you can get better. Mm-hmm. But the more time you spend up there, the more you actually bring that level down. So you have to have this mix.
Right. So you're exactly. So if you do something that's over that tolerance line, I should have just put that there. But whatever. You have the tolerance. You do more, then all of a sudden this line is going to dip down. Right. It's going to be down here. All of a sudden, your tolerance has gone down, and that will last for a few days. So now, in order for it to be tolerated, you have to make this significant drop down in intensity. Now, that will go back up.
Yeah.
If you stay here,
and it'll go back up higher when you do this, then when you do this.
Yeah.
But exactly what you said, but you have to come back down you have to let it go back up.
You don't know this line. Tolerance line, you can tell because your body is telling you it's responding, it's tolerating or it's not. It's recovering well, you're feeling well the next day, or it's feeling like you hit a train.
And that's the hard thing with the tolerance line is, it might be the next day, or it might be the next day that you realize that you are way over that line.
Yeah.
It's hard.
It is hard. That's something that I try to really work with people on, and something has to be said that not every day do you have to beat the minimal effective dose.
Yeah.
Sometimes you're feeling like crap, and it is totally fine to do a workout that is not effective in terms of making you more fit or better because of that workout, but it's doing something that you know is well below your tolerance, so the tolerance can recover. And as you recognize, I'm feeling better, I'm tolerating things better, let me start to push this back up the next day or two. Totally fine. Yeah. Totally appropriate. And if you're really having pain and really having issues, it's lasting for more than a day or two, it's lasting for a week or two or several, sometimes it makes sense to just hang out here for a little while.
Yeah.
And then push that back up over time.
Yeah, that's awesome. What a term I like that I've heard is this would be working in.
Okay.
You're actually working on, you actually are assisting recovery, where the other ones would be causing damage, but damage that is good for you.
Right.
But a good example is the workout, and I don't know if you did them with us the last few days, but we had one day that was a lot of bicep. It was dumbbell hang cleans.
The one that I was coaching.
Yeah.
I'm still sore from doing
exactly. So there's a lot of bicep. And then the very next day, we're doing, there's deadlifts, running, and burpee pull-ups.
Oh, yeah.
So on the surface, it seems like, well, what a bunch of idiots. We're using biceps 2 days in a row. But the amount of burpee pull-ups people were doing, and they were jumping pull-ups. Mm-hmm. And when you do a burpee pull-up, you're not linking them, so we don't have the negative portion of it. So we only have the actual pulling up, which causes less muscle damage. There wasn't a lot of volume, and there was jumping. So even though we blew biceps up, so probably somewhere in this range, and then the next day we did biceps again. We actually did biceps in this range, promoting blood flow. But on the surface, you might look at it and be like, well, my biceps are sore. Why am I doing pull-ups? It's like, well, we're dosed it.
Doing a lower dose.
Exactly. We dosed it at a level where this is only going to be beneficial movement, yada, yada, yada.
Well, and that's the point that I like to make is, okay, so you did this, your line dropped like this. You don't have to go down this far. You can do things in this level, which are still going to be an effective workout, and maybe not obviously as intensive a workout. But you can drop it 20, 30, 40% maybe. You don't have to go 100% down. Too many people say, oh, this happened, can't ever do that workout again. I'm going to stay down here for the rest of eternity. Or until this line goes back up. But really, if you're working out down here, there's no reason for your body to elevate this line. It's like, we're tolerating everything we're doing. Why would we need to tolerate more? You want to increase your tolerance. You want to flirt with that line. Blue on blue.
And I think what you're saying would be more of a like week by week basis of like bringing the weeks down. But if it's a day by day, one big thing and then doing nothing would bring this down. But then doing nothing, it would still go up.
Over time it will go down and it will come back up just because with your tissue adaptation.
Exactly.
Correct. But that next day, while your tolerance is down that next day, well, then you don't need to stay up here. You can come down for a day, and then it'll feel better, and you can go back up the next day or two. It should, again, tolerance can change fairly quickly. So this is not necessarily something that has to be weeks at a time of being lower. You can. And this is something that, in my mind, when I'm working with someone, the basic exercise person shows up every day. Is consistently working out. Second level is they can push themselves every day. The third level is this, being able to adjust and saying, I know that the workout says this. I recognize in myself I'm not been tolerating things very well right now, or I'm not feeling very well right now. So I'm going to go on the lower end of the prescription. I'm going to maybe do 10 pounds less than the prescribed dosage. I'm not going to push my rate of exertion to 100%. I'm going to do 70% or 60% today. And that will make me feel better. So tomorrow I can go back to 80 or 90% or go up again. And that's the high level, exercise person, workout person, is the person that isn't just slamming through the wall. I must go hard. Every time must be hard because I recognize that hard is what gets stimulus and makes you, improve your fitness. That's totally true. But it doesn't always make you feel better to go hard all the time. And in the short term, and you can tissue breakdown can start to occur. And things can start to happen. So that's where my second graph goes. Everyone remember this one, all right? Taking this one away, but those principles still apply. We're just plotting it in a different way. So think of this one as we drew our line here. That distance from 0 to that line is 100. Is a distance is basically the intensity that we're plotting. So on this graph, that's going to be what we're plotting. Instead of a curve, we're going to have a little plot. So I'll show you. So this is how you should, maybe how I like to respond to these types of things. So down here, this is time. Okay, think of this as days over time that happen. All right, again, we can have a couple of those same lines. We're just not doing time or volume and load. We're just doing overall capacity, okay? So again, we have our capacity line is up here. And it's just a straight, well, it's not gonna go that long because it's gonna fluctuate a little bit. But we've got our capacity is the solid blue line. Our tolerance is the dotted line, okay? And then the black is going to be what we actually do, okay? So most of the time we're working out just below our tolerance. If you're a veteran at working out, you know what you tolerate, you know what you don't, and you tend to work out there, okay? And this is going to work better if I draw it a little bit closer together for this one. So if you're healthy and you're training and you're doing things often, your tolerance line is fairly close to your capacity line if you've been training in any way, significantly. So you usually stay below your tolerance line, but let's say you had an incident occur, something happened, you thought you put 25s on and over 45s, and you go to do an overhead squat and you just crumple because you couldn't handle it for whatever reason or whatever happened. You decided this day, I'm going to do something that's up here. All right. Now, this activity...
I'll put it in CrossFit terms real fast.
Yeah.
This could be an RX weight on the board that's out of your wheelhouse.
Perfect.
And you're pretending to be an RX person.
Yes. You did the RX. Turns out you shouldn't have. In this case, we have crossed the capacity, the hard blue line. Injury occurs, okay? You tried to do too much, and injury occurs. So what happens when we have an injury? Well, immediately when that injury occurs, your tissue is no longer as strong as it was. It goes down, all right? Pretty quickly, your body recognizes, crap, something has happened. Protect ourselves. And so almost immediately, but usually maybe an hour later, because sometimes during the workout you don't even notice it.
Yeah.
But sometime after that, your body is going to have its tolerance is going to go down too, significantly, okay? And there's a response to an injury. And you, somewhere herein lies your decision, oh man, that shouldn't have happened. Your activity level is going to also drop down, all right? Ideally. But now we're in this situation where our capacity is down here and our tolerance is down here. All right. Okay. And we're not doing anything. Let's say this is a real injury. You sprained your ankle, your shoulder dislocated when you had the bar overhead with too much weight, something like that. As you recover, again, if you have an actual tissue injury, it takes time for your tissue to heal, okay? The sensitivity can fluctuate fairly quickly, so you can actually feel pretty good pretty quickly. So for some people, this dashed line is going to start to go up. So is the solid line. The capacity line is also going to go up, okay? But not necessarily at the same rate, okay? And so maybe you've been resting this for a couple of days, and you notice, I'm starting to feel better. Feeling, again, harm, tissue integrity, and pain don't go together. Not only does that go with when you can have very minimal injury and have a lot of pain, you can have a major injury and actually not have that much pain. Or the first day, you can recover from the pain fairly quickly sometimes. So you're feeling better, you start to increase your activity day by day, and then let's say you get to this point. Well, when you did that, you crossed the injury line again, the capacity line, and so you injure yourself some more, all right? And so then you're gonna have to drop back down. All of these lines go back down when you injure yourself again, okay? Let's say we took the extra conservative approach though. We knew that we really injured ourselves. Doctor's orders, you met with me, you met with Chase, you met with the surgeon, and we told you, take time off. We let this heal. So time has gone on, our capacity has come back up. And we kept our activity level down for a while. Our tolerance also will go back up. And let's say in this situation, our tolerance has not caught up. Our body's still protecting ourselves. That prison guard, we'll even give it a little bit more of a buffer. We'll say the prison guard is still being pretty cranky. So there's a gap between our tissue capacity and our tolerance to stress. But we start to recognize that there's a difference between what we're doing and what we can tolerate. It's like our body feels great when we just walk around. Let's get back to going to the gym. And so we increase this line again. And then, let's say you do it perfectly and you're just below your tissue tolerance here, then that stimulus is going to stimulate, you're going to tell that prison guard, it's okay, nothing happened. and your tolerance will go up again. Okay, I couldn't overhead squat because I injured myself. I tried again, injured myself again. I took some time off. Let's try overhead squatting with just the bar. And the bar was fine. Okay, nervous system, turn down. Allow us to do some more, okay? So now we say, okay, everything went fine, no issues, no setbacks. We're going to continue to increase. All right? And then, what if you cross this line? You say, okay, well, let me try going from the bar to 75 pounds. Well, fortunately, our tissue capacity is still up here. So we didn't injure ourselves again, but we crossed the sensitivity line. We irritated ourselves. We made ourselves sore. And that line is going to go down again. We're going to be sore again. Now, how should you respond to this? That's kind of the big question. Well, we already know from tissue adaptation that this line will go back up over time. So ideally what you do is you just stay at this point. Again, that's what we said. If we have an injury, we have one day, we have pain, come on. And our shoulder was what got injured during the overhead squat, and it's been months and we were overhead squatting and our shoulder hurts again. What do we do? Well, get through the workout, see if you can bring the load down, see if you can just get through the workout and modify it a little bit, and then see how does the tolerance respond over time. So I'm just going to keep that intensity, and maybe it's a couple days that or a week or two that I'm staying at this intensity, and I notice I'm tolerating that intensity again. Oh, this is going up. I'm getting closer to it, and this is still going to go up as well. Then you say, you know what? I'm back to where I'm doing less than what my body tolerates. It's feeling good again. I'm feeling comfortable with that 75 pounds, we'll say, just for an easy number. And as that capacity goes up, you say, hey, I'm feeling better. I'm going to start to go up too. I'm going to go up in here and increase. And that's the game you play, because again, this is an impossible to know thing. So you can't get too upset with yourself if you cross that line again and say, oh, crap, I did it again. That's the process. Yeah. That's that process of recovery, of recognizing, okay, this is not going up, so I need to adjust until we get back close to where we were previously. This is going to be a game that we play, snaking up and down. Yeah. Okay? So
is there a way to know when you've gone here and you should stay, or when you've gone here and you need to pull back?
Yeah, so how I look at that is, how big of a blip was this? How long did my tolerance go down? Yeah. Okay, so let's say...
So what are some indicators, like how you feel, what things are going on, that you overdid it, but overdid it in the way where, like, stick at the same weight?
So that's kind of where I use that 24 to 36 hour recovery. If you're recovering within that 24, if you didn't feel sore at all, you can keep going up. Yeah. If you're sore and you recover between 24 and 36 hours, maintain that intensity until you're recovering quicker than 24 hours, or not having any issues. If it's taking longer than that 36 hours, it's taking 48 plus hours, it's taking 2 or 3 days for that shoulder to feel better after that overhead squat, bring the activity back down a little bit. Got it. That's what I tend to do. Yeah. So let's say that same scenario, we surpassed our activity level, went back up, and hopefully people can see this on the video, but we went back up, and so our tolerance said, oh, we didn't like that, and the tolerance goes down. And what you should have done is recognize that and plateaued here until it recovers, but you decided, I'm going to keep progressing anyways, because I didn't hurt myself, I didn't injure myself, my shoulder didn't pop out, it didn't break again, this didn't happen, so I'm going to keep going up. Well, very likely, your tolerance is going to continue to go down. And that's where, okay, instead of this drooping for 24 hours and coming back up, it's taking another day. Oh, and I did it again, and it's going down, and it's going down, and it's going down. And so when you recognize that my tolerance is going lower over time, it's not getting better, even if I give it some rest, even if recognize I'm not giving it rest, then instead of being able to I flipped the caps on these. Instead of being able to respond, when we initially were able to, okay, it dropped down, now you just plateau here, until your blue line comes back up. Messing with my lines. You were waiting until this comes back up, and then you'd start to go back up from here. But because you didn't make this decision, you made this decision to continue to increase, now you're going to have to back off, right? Instead of just maintaining until your tolerance comes up, because you kept going up and this kept going down, and now you're at a really low level, it hurts just to raise your arm overhead hurts now. Instead of 75 pounds being irritating, any weight overhead bothers you. Mm-hmm. Just putting your arm overhead is down here, because we can also put on here lines of, okay, this line is what you need to do for daily tasks, activities of daily livings, and this line is your normal exercise activity that you would normally do. Mm-hmm. So you want to get back to this level. But let's say I'm not great at drawing these kinds of things, but you now have gotten to the point where your tolerance to stress has gone down so low that now you have to take your activity level, and the only way this is going to really come back at this point, when it's this big of a gap, you got to come way back down. You may not have to go all the way down to the low tolerance, but you don't know how low, so it's easy just to go below tolerance.
Yeah.
And you're going to have to come back down and work your way back up here again. Okay? So the biggest key for me is recognizing that the process in terms of it's not a linear thing. Tissue healing is linear, tolerance is not. You don't marry your activity level to the capacity. You don't just go up because you know that, tissue heals in a certain amount of time, I can go up. If your nervous system is telling you no, there's not much you can do. It's going to get worse and worse, and it's going to become more irritated. And again, we're not talking about necessarily tissue damage here. Your risk of really, really causing your bone to break or something like that is still it's still higher than it was at this point, mm-hmm. because we're earlier in that process. But you want to pay attention to that dotted line. And this linear progression isn't how it goes. We think it goes like that, but really it's going to go up and down. It's going to go up and down. It's going to go up and down over time until you get up there. And the people that continue to make that progress are the people that recognize when they're in a down and level off, okay, and maybe don't even dip, right? You just level off here, and then you make a progression, and then you level off here, and then you make a progression and level off, and you don't progress quicker than your body tolerates. This is where a lot of people have a lot of trouble. They have an injury, or they have something happen. They think that they can just take this time, and then they can just go straight back to here. And then they cross this because they were used to doing something up here. Well, now they have injured themselves again, so that would be way too hard. But even more so, people keep not respecting the tolerance line. And so they keep having this chronic shoulder pain. They think now they have this idea, my shoulder is broken, my shoulder cannot do anything. And it's really, you're just asking it to do more than it can do. And if you dial that back down, build it back up over time, you can get back to very close to what it was pre-injury. And there's people who get above that line after they've had an injury.
Yeah, what I've learned from my stuff going on is usually through this process, mm-hmm. the thing that helps me stay below the tolerance line, or at least near it as you chip away.
So you don't have to be straight under it. You can flirt with that line.
The technique makes a big difference. And so through that process, my technique improves dramatically, because bad technique, I have less of a tolerance for it. And so good techniques, I have more tolerance. And so through that process, it really has helped me get way, not just barely, way beyond where I was before. And it's not short.
Yeah.
But because I learned so much through the process of it.
Yeah.
But then the other thing too is you can keep your shoulder below these lines and push other things.
Yes.
And so you can still have that feeling of being an athlete and working out, and just be smart about it.
Yes. That is a message I also share with a lot of my clients, is to remind them, okay, so your one knee is giving you trouble. Your other leg works just fine. Your core works just fine. Your upper body works just fine. There's a lot of stuff, your back works just fine. There's a lot of things that you can still do and should still do to stay active, to get that release of endorphins and growth hormones that's going to help with the healing process for your leg.
Yeah.
But just exercising everything else and not exercising the injured part is going to help the injured part.
Yeah.
And so don't get too bogged down on the injured part that's down here. Remember that your other body parts are still up here.
Yeah.
And they will go down, and they will go down. Unfortunately, when you have an injury, you're not going to probably work out at the same intensity. But you should try to keep those as high as you can and not let your whole body become really low capacity.
And there's another reason why it's like, oh, back hurts, rest for 2 weeks. It's like, well, now you're bringing everything way down.
Right. And so it might be back hurts, okay, don't do Jefferson curls when your back hurts. Although I give all my back pain patients Jefferson curls at some point because it's very focused and easy to dial that in with the back. But anyways, don't do the thing that irritates the thing that's irritated. Don't do the stuff that crosses this line. But there's probably a lot of things that don't do that.
Yeah.
There's a lot of things that we can offload stress in other areas. And don't lift with your knee. Do more straight leg deadlifts. Work your glutes, work your hamstrings. Okay, your shoulder's not doing very well. Well, then don't do snatches, maybe do cleans. Maybe do back squats instead of front squats. There's some modification there in terms of both exercise choices, but sometimes it's just the intensity. Again, sometimes you can just take that intensity down some where it doesn't affect, it's still getting a good workout for all the areas that are tolerating good workouts, and it's still giving a stimulus to the area that's intolerant, but you just have to find that balance.
Yeah.
This is hard. This is not something that you should expect as a everyday average Joe who has this is my life, right? Mm-hmm. This is all I spend my time thinking about all the time. Someone that is just going to work and just coming into the gym for an hour to get their exercise in and doesn't have the time to think about this stuff, you should think about it and you need to be mindful of it, especially in group classes when the coach can't feel this for you. They can't read your mind and know really well, and they're not creating a chart for every 15 people in the class of, well, how's Chase tolerating this, and how's Jared tolerating this, how's David tolerating this, and being able to tell you. They can tell you some. They can give you some guidance, but no one knows your body better than you know your body if you take the time to listen to it. And so that's where in the group environment, you have to be able to step back and say, okay, I know this is what's prescribed for the group. I'm not at my best where I can really do what the group can do. I need to modify it a little bit. And that's where talking to the coach and telling them, I'm not sure, based on things that have been going on, that my back can tolerate this workout today. Do you have some suggestions that can bring down the intensity on the back today?
Yeah.
And being comfortable with communicating that to the coach and working with the coach on those things.
Yeah.
But that's also where working with a therapist helps, because now I don't have 15 people, I have just you. We'll spend an hour and a half going over your issues, talking about your history and your training, and okay, how's your sleep, how's your nutrition? Because again, those affect these lines as much as the physical activity does. It's just we tend to focus on physical activity because we're in a gym and we do physical activity.
Yeah. And
I'm a physical therapist, so we focus on that. But also, okay, well, you should be sleeping better. You should be eating better. Going back to the cup, going to fill your cup, and that's going to increase your tolerance as well. I'll figure out all these strategies, and then what do we need to do in terms of messing with our workout routine so that you're also staying in line here?
Awesome, dude.
Yeah. So that's kind of basically what my approach to pain and injury is plan A is to help people develop their relationship with their body, their understanding of what the messages their body is telling them. It's not pain means stop. Pain means I can't do anything. Pain means I'm broken and damaged and I need fixing before I can do anything. Pain means pay attention and focus and learn a little bit of what's going on with your body. Mm-hmm. And sometimes it's so complicated that we all pull out our hair and say, we actually can't really get to the crux of this issue. We don't know why your back is bothering you today, but we have strategies to address it. Sometimes you don't even have to know the cause to be able to affect it.
Yeah.
But developing that relationship with your body, learning how to navigate and respond to pain. I don't like to say learn how to control pain because you don't control it. Mm-hmm. You have to drop the ego a little bit there and just recognize there are factors outside of your control that affect this. And you can do everything right, and then your boss comes in and lays a big old new project on your lap and pain spikes back up. Mm-hmm. You can do everything right, be taking care of yourself, and then your kid gets sick. and you have this stress because your kid is in the hospital, or you're not even that bad, but your kid is not sleeping at night, so you're not sleeping at night.
Yeah.
And so even though I'm doing everything right, because I'm a new parent or my kid is giving me issues, I'm struggling right now to keep up at what I consider my best. Well, don't try to keep doing that. Accept that in order to feel better and be able to stay in some semblance of healthy and physical activity, still keeping up with some physical activity and not letting that tolerance continue to drop, I need to just bring it down for right now.
Yeah. And I think that's so important, is people are so worried about being at their best all the time that they're not, they do this and they forget that, like, long term, if you push this too hard, you're gonna have, it's like your body's gonna make you take a step back at some point. So you can either choose to and do it in like the smartest way possible, or you can push the limits as much as you can and risk really having to take big steps back and just prolonging what's going on.
So I think, yes, being able to recognize when your body is telling you, giving you messages, something is, we're not tolerating things as well. Again, the physical activity may not be the cause, but it's it's one of the easier things for us to manipulate and change over time. You know, we can't change our work stresses that much. We can't change our home stresses that much. I mean, you can do drastic measures, but in a lot of ways, you don't want to rock those boats as much. It's much easier to say, I'm going to take a day off from my workout, and not even, again, I'm going to take a day or 2 or 3 and work out not as hard. You know, it's a simpler, less of a burden on our life overall to make those kind of changes. And, you know, still focus on sleeping and eating well and doing those types of things, than it is, I need to change my job, I need to quit you don't want to do that, you know. But yeah, so trying to respond through activity modification, that's what we do, is okay, make better choices, you know, and it's not even better choices, it's just different choices for your body right now. And recognizing that your tolerance changes over time, your capacity changes over time. You can do everything right, and just time is occurring, you're aging, your capacity goes down in general. Now, if you're working at a maximum capacity, as you age, maximum capacity goes down. Now, if you were never working at a maximum capacity, you still have a lot of room to go. You can still, if you never worked out before and you pick up the weight for the first time in your 50s, you can get stronger than you've been, you know. So there's nuance there. But in general, there's factors like aging that you can't control. Another thing that should be said is that you're not operating at 100% capacity very often. You know, it's kind of, if we're looking at a percentage, if this top line is 100%, probably only 10 to 20% of the time are we actually feeling 100% and actually functioning at 100% of our absolute max.
And I think that's super important for competitors to hear, is don't expect, it's like, yes, we're going to try and peak you and have you optimally ready for the competition, but don't expect to feel 100%. You're always going to go in with something. Expect that to happen and embrace that that's normal and everyone else is going through it too, and don't let it get you down. So don't let it get you down, but also dose yourself appropriately and say, okay, so probably 10 to 20% of the time, 10% if you're lucky, you're really good at stuff, 20% if you're an average, is I'm doing awesome, I can push myself to the max and do it well, and tolerate it and recover well and perform at that max. Probably more like 60% of the time you're in a moderate zone, where a moderate level of activity is going to be the right choice for you. You want to match your activity level to your current load capacity that day. 10 to 20% of the time you're at a low level. I've just, at wit's end, I can only tolerate very low activities today, or for this week, or for whatever amount of time. So again, those extremes, you don't expect that to happen, don't want to be in the low extreme, of course. The high extreme, you would love to be there, but just be realistic. You're not going to be there all the time, or even half the time, or most of the time. That's just recognizing things have been going well. I've been doing really well. Let's push it today and see what happens. And, you know, hope that it goes. And if it doesn't go well and you go back down, be forgiving of yourself, and it's okay that you learned that. You learned what your tolerance was. And exactly. Go back to that guess and check, and don't think, oh, well, can't do it. It didn't go well. I didn't do it and tolerate it well, so I can't ever do that again. It's like, no, just recognize, okay, 500 pounds was too much for me.
let me train at 490, for a while longer before I try to go to 500.
Yeah.
And just be honest with yourself in terms of it's okay that we're not at 100% all the time.
Yeah, and you don't need to train as hard as you can to get better.
Yes.
You got a big buffer zone.
Going back to that minimum effective dosage kind of stuff.
Exactly.
You don't have to push to the maximum all the time or even most of the time to still get results.
Yeah.
And that's that's a lot of what I'm doing with people is figuring out, is this someone I need to rein in that they're trying to do too much?
Yeah.
Or is this someone who never does enough and they don't feel like they're getting any results, but it's because they're not giving themselves the minimal effective dosage? I need to push those people along and rein some people in, push some people, read people's personalities, determine, try to figure out what they've been doing. And it's a guessing game basically, but based on those trends, do I feel like, well, you haven't had success. Have you been trying really hard? Yeah, I've been trying as hard as I can. Try less.
Yeah.
Well, have you been trying hard? I've been afraid to. I haven't done anything.
Yeah.
Try a little more. Try a little more.
And I think those people that need to be reined in, I think they have a hard time of accepting that you're trying to help them.
Yeah.
And it's like, I wouldn't tell you this if I didn't think this was going to make you way better.
Yeah.
Like, I wouldn't be telling you to work out less if I wasn't confident that this is going to make you way better.
Right.
And they're just, more is better, more is better, more is better. I got to push, but got to push. There's so much value in pulling back sometimes.
Yeah, exactly. And I think unfortunately because there are a lot of healthcare providers who it's a lot easier just to tell them to do less. Just don't do that much. Or they have an opinion because in that person's own personal life, they don't exercise at near the intensity that you do. They haven't trained themselves to do it. And so you tell them what you do. What do you do?
Yeah.
No, don't do that.
Yeah.
Don't do that. You can't do that. You should never do that.
Yeah.
If someone is giving you advice in absolutes, question them immediately.
Yeah.
Because nothing is absolute. And it's not a permanent situation. And it should always be dial it back for now, see what happens in the future if you can dial it back up. And we'll be optimistic that we can increase your capacity back up. Now, sometimes you just have high expectations that you're not going to be able to meet.
Yeah.
Some people have that, but certainly, unfortunately, because a lot of healthcare providers just because of their experience, their biases, and also they don't want to get sued by someone who they give bad advice to. It's much easier, it's much safer to give someone the advice of don't do anything, and then they can't really say that it was your fault. But if you say, go ahead and try, and you get injured, then you might, that's where we're living in a litigious society has actually stunted our healthcare a little bit and made it overly cautious, overly protective in some ways sometimes. But that doesn't mean just ignore all healthcare advice and just do what you're going to do and be bullheaded about it.
Yeah.
There's some semblance of truth, right, to that, and it's really understanding that it's all gray. No one gets it perfect. No coach, no personal trainer, no athlete prescribes themselves at a workout intensity that's exactly the right intensity every time. Sometimes they overshoot, and looking back, they're like, man, I was stupid. I did too much that day. You weren't stupid.
Yeah.
You just did too much that day.
Yeah.
Honest mistake.
And now you got to pull back a little more, and it's fine, and let's move on.
Learn from it. But no, you're trying to hit a moving target, so learning from it doesn't necessarily guarantee better results in the future.
Yeah.
But move on, move forwards. And then there's other people that are going to do something, and they're going to say, I could have pushed harder. I had more in the tank today. That workout, I didn't think I could do it, and pleasantly surprised, I could have done more. And some people will feel frustrated by that and say, I missed out on that opportunity.
Because I think people put too much focus on one training day.
Yeah.
And it's like, if you've been, like a lot of us, if you've been training for 10, 20 years, you look at one training day as a joke. Like, oh, what happened on this one day 10 years ago has nothing to do with where I'm at right now.
Right.
And so it's usually, I think, the newer people that are putting too much focus on today. And it's like, just be consistent, you're going to be great.
Yeah.
Be consistent, you'll be good.
For sure. So that's mainly what I do with people, and from a physical therapy perspective, when we're dealing with pain and injury, and not necessarily a traumatic surgery kind of incident. We know they're going to need to work on developing capacity again. Mm-hmm. But my first step is always, can we navigate this pain? Can we manage this pain? Can we do these types of strategies and affect just simply by changing our dosage and programming a little bit for you? that's going to help you elevate yourself. Sometimes that's not always going to work, so that's where plan B comes in, and sometimes you do both of them, but that's where we establish a loading program. Okay, your shoulder is not tolerating higher doses of loading over time, so we need to apply specific corrective exercises to your shoulder to increase your shoulder's tolerance to stress so that you can get back to doing what you do. Mm-hmm. And so that's kind of that two-pronged approach, is generally looking at your workout program, diet, nutrition, sleep, stressors, all of your whole total general livelihood, and seeing what of these factors can we affect so that the size of your cup and the amount of fluid in the cup are matching, and then we can build a cup over time. The building the cup, that's the loading program. And so that's what people think of as giving them exercises, and that's a big part of what I do, is prescribe those exercises to hit that specific tissue. But sometimes that exercise we're prescribing is the overhead squat that you want to do, and just saying, I'm prescribing at a lower intensity for you.
Yeah.
I'm prescribing, you want to get better at overhead squats? Overhead squat with a lighter weight, work on holding it at the bottom, isometric holds at the bottom, work on something. It's just a tweak to the same exact exercise versus, you need to get a band and do some rotations and stuff. Well, that might help, and that can be tolerated well, and that's isolating this area, so it's very easy to manipulate those based on how your shoulder feels. Versus overhead squat, well, my hip was limiting me, my back was limiting. There's other factors, but in general, you'd like to approach it from that more general approach and more looking at what's the task you're trying to get back to, and let's try to do things that mirror that task as well as we can. And if you can't, then you break it down. Okay, what are some basic exercises, accessory exercises you might see them as called, that can target the tissue that's not tolerating things in isolation from the whole body, and build that capacity over time. So a lot of what I do is actually more communication, right? It's this talking people through this kind of stuff. It's coaching them, it's supporting them. And we do that. The first session, I might give you one thing or two things, it might be a couple exercises to get you started. It might be education to avoid or limit this, or let's bring down that intensity. And so only lift X amount of weight, for now on that lift, and just go easy on it, and listen to your body. And then this, after a couple sessions of coaching people through and talking to people through, we'll trial and error some exercise ideas and some concepts to see what do you tolerate, what don't you tolerate. And once the client and I have a pretty solid understanding of what their tolerance is right now and what needs to happen, then it's coaching them through as they increase that capacity and mess with those lines and say, it seems like you're tolerating this well, let's do more. And then they come in and say, oh man, I'm having more pain. And well, it seems like you're not tolerating that as well. Bring your activity back down to match it. And they might see that as a regression, but that's just the reality of how it goes. It's not a regression. I mean, it can be a regression in some ways, but that's just how you have to do it. You have to respond in that undulating way and not expect a linear progression all the time. And that's where people get frustrated and say, I'm not getting better, every day, so this isn't working for me. And understand it's a process. It's an ever-changing process. It's an imperfect process. And that's why having someone talk you through it and help you coach you through it and kind of be an outsider's perspective on it is helpful versus I'll do it myself. You can do it yourself. If you really want to and you have the knowledge and know-how and the confidence to modify your workouts on your own, and you want to take the time to look up YouTube videos of specific shoulder or hip or back exercises or whatever, you can probably do it yourself if you want to put on all the time and effort. But
fast track it with an expert.
You can get it more cleanly and more crisply and more efficiently with the help of an expert, with someone that knows what they're talking about, who has the experience of working with a lot of other people that have had similar situations to be able to tell you, this is normal what you're experiencing, this is not normal, we need to go see a doctor because something wrong has happened. Or, this is part of the process, just keep doing what you're doing. A lot of times that's my advice for people. It's like, that's fine, that's normal.
And getting that reassurance is huge for the client. Huge.
So I'd say that's probably what I help people with the most, is we build a relationship, identify what they're tolerating, what they're not, identifying their goals. Does it even matter to you that you're tolerating or not tolerating this? And then develop a plan for them and understanding the plan can change at any moment. But just setting up a plan and following along that plan over time to get you back to what you want to do.
Awesome, dude. I think we did a bunch of hours here.
Yeah, I think we did a long time. But
so good, though. I had so much fun. Thanks for joining us.
Sure. Yeah, thank you, guys. And if you have any of these kind of issues and you've tried talking with the coaches, you've tried doing some modifications on your own, you've tried tweaking things on your own, and it's not gone well for you, come talk to me, and I'll be happy to talk to you about it and give you my opinion. And whether you need to work with me in a formal capacity and have multiple sessions with me, or you just need one session to sit down and talk through a strategy, or maybe just me encourage you, you're doing the right stuff, just keep doing it. It never hurts to talk, and that's what I would recommend is with all this kind of stuff is give it some time. Don't be too reactionary in a day-to-day basis of something came up, I'm done, But if things are lingering or we're having recurring things happen, definitely come and see me. And it never hurts, even if you're not sure if it's something worth saying, because a lot of people say it's not a big enough deal to talk to you. Talk to me about it. Yeah. And then, like I said, it's a lot easier to take care of a minor issue that's a minor programming tweak, or just widen your arms, man, and you'll be fine. Just let your feet go out when you're having more knee pain, and if it feels better, do that until your knee feels better, and then you can go back and squat however you want. Sometimes it's that little amount of advice, but that little amount of advice can make a big difference. And so don't hesitate to reach out, and I'm around.
Perfect. Talk to y'all soon.
Later.